Hi, my name's Joe Bellick and I'm the founding partner of the law offices of Bellick and Fox. We support the mesothelioma community by providing first quality legal representation to mesothelioma patients and their families. We're proud to support the Mesothelioma Applied Research Foundation so they can continue the work that they do every day on behalf of mesothelioma patients and their families.
Hi, I'm Trey Branham. Dean Omar Branham and Shirley is proud to sponsor this year's Mesothelioma Applied Research Foundation Conference. The 34 lawyers at Dobbs have more than 400 collective years providing legal representation to victims of this insidious cancer. We applaud the leadership of MARF and this community for its tireless dedication to finding a cure for this totally preventable disease.
At MRHFM, we exclusively help mesothelioma patients and their families. It's all we do.
This is why we are proud to sponsor the Mesothelioma Applied Research Foundation and its work to fund mesothelioma research and provide support services and education for patients and their families.
just eaten dinner or lunch. So I hope you got some caffeine as part of your libations at lunchtime. I am pleased to introduce for our first session this afternoon, Mesothelioma and Mental Health, presented by Stephanie Alonso, who's an oncology social worker at my alma mater, the University of Chicago Medicine. So, Stephanie? Is she here? There she is. The clicker is yours.
Let's see if we can use the clicker. So hi everyone, I'm Stephanie Alonso. I am a licensed clinical social worker at the University of Chicago Medical Center. So thank you all for having me here. We are going to talk about mesothelioma and mental health. Hopefully at the end of this, you'll be able to understand what anxiety and depression are, and the impact that they can have on someone as we're going through a cancer journey. So at the point of diagnosis, during treatment, and after, whatever after, may look like. So in the spirit of this not being the most ideal time to present, I thought we would start with a little bit of a breathing exercise. So you may have heard of box breathing before. Essentially, it's in for 4, hold for 4, out for 4, hold for 4. If 4 seconds is feeling difficult for anyone, you can do 2, 3, whatever works for you. And if you're at home and trying to use this, if it's feeling hard to get those deep breaths, you can always try to breathe in front of a fan, but we'll talk a little bit about that later. So let's just start. I'll wait for my little timer to go. So in, hold, okay, so hopefully we're all feeling a little bit more grounded. Thank you. That was as much for me as I think it was for you. So we can get going. So before we can talk about, anxiety and depression, we have to recognize how cancer impacts someone. And the truth of the matter is that it affects your whole person. So if you're a student, if you have a job, your role within your family, your goals for your life, a cancer diagnosis can touch any of those areas. Getting a cancer diagnosis can create or exacerbate any psychological or social problems that you may already have. So maybe you were already someone who was dealing with anxiety. Getting this cancer diagnosis may add to that. Maybe you were someone who was already struggling to make ends meet. This cancer diagnosis is certainly going to add to that. Every person through their cancer journey is going to have a unique experience. Based on your type of treatment, if you're only going to the hospital once a month for immunotherapy, that's going to have different stressors than if you have to come for daily radiation for 8 weeks or something. Your personal stage of life can be impacted. So if I'm a young parent and I'm juggling school drop-offs and homework and all of those things at this current stage in my life, my stressors and my concern are going to be different than if I'm a senior who's maybe widowed and I don't really have a lot of support in the home. They may have different concerns. Your type of work, if you're someone who works at an office, maybe things can keep going, as usual. If you're a construction worker, that may be different, and you may have to think about how you're going to keep doing your career while you have this diagnosis. And then just some of the other general ideas, like having cancer comes with taking time off work, medical bills, new appointments, lots of demands on you. So what is anxiety? It's a feeling of dread or fear or worry. We've all experienced anxiety at some point, whether that was test-taking anxiety, anxiety for a new job interview, anxiety giving a presentation at a conference. But some level of anxiety is helpful. You know, it helps us grow. It helps us make decisions. And I'm sure there are lots of things in your life that were anxiety-inducing before, and now you've gone through them, and now you can do them easy peasy, no problem. Some of the feelings or the mental symptoms of anxiety are just that you're feeling like you can't stop worrying, you can't concentrate because all you're thinking about is whatever this stressor is. You feel restless, you're on edge, you're snapping at your family. Some of the physical symptoms are poor sleep, headaches, stomach aches, you're having a racing heart, chest pain or chest tightness, you're feeling short of breath. I don't know if anyone's seen the Inside Out movies from Disney. Inside Out 2 came out this summer, and they introduced anxiety as a character. I think that the little illustration kind of sums up how we feel, just like so tense, so frazzled, trying to make it all work, but you really have something else on your mind. Moving on to depression. So depression is a persistent feeling of sadness or a loss of interest in your usual activities. I want to highlight it that it's this persistent feeling. So we've all had ups and downs. We've all been sad. We all go through things. But it's that persistent feeling is when we are coming into thinking about depression. So kind of like our friend Eeyore from Winnie the Pooh, like no matter what's going on, how much fun Winnie the Pooh's having with all his other friends, Eeyore's just always feeling down. A lot of the symptoms overlap. So for emotional symptoms, like I said, you're feeling down, you're feeling sad, you're not able to concentrate, you have lost interest in any of your typical activities. So maybe you were an avid runner or biker. Now you're not wanting to get out there. You're just staying home. You can barely get out of bed. We're feeling hopeless. We're kind of withdrawing and isolating ourselves. And in some cases, there could be thoughts of death or suicide. And then the physical symptoms. So you're feeling tired, just really not in the mood to do anything. You have poor sleep, whether that's not sleeping enough or sleeping too much, similar with your appetite changes. So you may not want to eat at all. You may be overeating, and you might feel achy, again, tired, have different pains, and just generally not well. When I was preparing for this presentation, I wanted to look at how often anxiety and depression come up for people with cancer. And so some level of psychological changes are detected among anyone with cancer. The rate of psychological distress, so anxiety or depression, is about 20 to 47%. I thought it was interesting that people with lung cancer diagnoses report higher levels of distress than any other diagnosis. And so 1 in 4 people with lung cancer say that they've experienced anxiety or depression. And in one study that I looked at the time of diagnosis, 23% of the people reported feeling distressed, and then that almost doubled during treatment, which was kind of surprising to me, but we can talk about that too. So I want to go into some misconceptions or things that you may hear if you're telling someone that you're experiencing depression or anxiety. Often these can be well-intended from family or friends. You know, they're just trying to help you out. But as the person experiencing them, it may not feel great to hear these. So the first one is you can avoid depression or anxiety. Like, just don't think about it, don't focus on it, and you'll be fine. If that were the case, I wouldn't be here, and I wouldn't have this job. So the reality is that acknowledging and validating your experience and talking will help you get through it. Another one, which I already touched on, is that depression is just feeling sad. Again, it's more than just feeling sad. It's this persistent feeling. It's not going away. Often we'll hear that anxiety and depression aren't real illnesses. Again, that's not the truth. They are real illnesses. They deserve as much attention and care as any other medical diagnosis, and they can be caused by stressors like a cancer diagnosis or different chemical imbalances in the brain. Oftentimes you'll hear people say, oh, if you talk to your doctor about that, you're going to get on medication and then you're going to be this zombie walking around and you're never getting off of it. That's not true. A lot of research suggests that the best treatment is therapy. So different therapies like CBT and DBT, which again, we can get into after this, are the preferred treatment for a lot of these conditions. Other people might say, oh, you're not that bad off. You don't need, to talk to a therapist or get medication. That's only for people who are so far gone. And that's just not true. So short-term therapy or medication can be helpful to get through a period of anxiety or depression and get you kind of back to a more normalized state. And then something else that I hear a lot is that, in my culture or people like me, we don't do anxiety and depression. We don't talk about it. We don't think about it. That doesn't happen. But again, the reality is that anyone can experience anxiety and depression. So be open to talking about it, thinking about it, and just acknowledging it is the first step. So we're going to talk about some different solutions throughout treatment, but I have to give my little social work disclaimer. If at any point you're in a position where you're considering suicide, you're considering harming someone else, the box breathing is not where we need to be focused. So you need to get immediate help. That can be calling a crisis lifeline, going to an emergency room, talking with your doctor, talking with your family. That's a serious medical issue that needs to be attended to like any other emergency. But if you're doing better than that, but you're just experiencing some anxiety, we have some different solutions that you can try to employ. So we did the box breathing. There's lots of different breathing exercises. Same with mindfulness, like Headspace and Calm. Those are two good apps. They have paid and unpaid versions where you can learn different skills, learn different tricks to kind of try to calm you down and regulate yourself. There are also different grounding exercises. So I like this one on the screen. It's the 5, 4, 3, 2, 1 exercise. So if you're feeling yourself becoming anxious, getting escalated, pause, and then try to find 5 things you can see, 4 things you can touch, 3 things you can hear, 2 things you can smell, and something you can taste. Taking that time will get your mind off whatever's causing you the anxiety and kind of ground you back into the moment. Also try to work through what is causing you this anxiety. So are you feeling anxious because you're worried about your medical bills? Okay, that's something we can control. We can talk about medical bills. We can talk about options. We don't want to just let our thoughts spiral and then you find yourself worrying about everything in your life. Other people like movement. So if you can get up, take a walk, go outside, go on a run if you're a runner, just something to move your body and get your mind off of what's going on. Has anyone here ever heard of Brene Brown? Okay, so yeah, Brene Brown is probably the most famous social worker at the moment. She has lots of books. She had an HBO special, and she has a podcast. And during the pandemic, she did an episode on the FFT. She uses a different F word, but for the sake of this presentation, we'll say the freaking first time. And so it's basically the idea that your first time at anything is really scary. So through a cancer diagnosis journey, there are lots of first times. So it's your first time getting diagnosed. It's your first time going to chemo. It's your first MRI. It's your first time ever having a recurrent cancer. So there are lots of firsts, and the best way, or she gives us some ways to handle an FFT, is first name it. So if you're feeling anxious because you just got a cancer diagnosis, you can say to yourself, this is new. This is my first time ever being diagnosed with mesothelioma, and it's okay that I'm feeling overwhelmed right now. Normalizing it, again, that's that. It's okay that I'm feeling scared. It's okay that I feel overwhelmed. Giving it perspective. So this is really hard right now, but I'm going to get all my information and I'm going to get things together, and it's not going to feel this hard, or it's not going to feel hard in this same way in a few months. And then reality checking our expectations. So because this is our first time, we don't really know what we're walking into. We have expectations. So maybe you're saying, oh, I'm going to work through all my treatment and this is going to be easy peasy and it's fine. Maybe that works. Great. Maybe we need to adjust as you go through. So this is a little bit harder. I'm going to take the day after chemo off. Things like that. And just kind of repeating this process as you go through it. Long-term solutions, talking with your doctor. Again, like I've been saying this whole time, any mental illness is just as valid as a physical illness. So let your team know. You may want to look into a support group, try to find a mesothelioma community of other people who kind of know what you're going through. Some people use medication. I will not get into all of the different medications and options like that, but they are out there. And same with therapy. And so kind of honing in on the different stages of treatment or of this journey. So what's going on when we first get diagnosed? So we can feel shocked, we can feel fear, we can feel confused. Why is this happening to me? You're getting information overload, right? I heard some people talk about that earlier. You go to the doctor, you get all this information. Maybe you're not someone who works in healthcare. I don't know what half these words mean. And then you're asked to make very quick, very important decisions based on this information that you just got. You're deciding, am I going to tell people? Am I going to tell my kids? Am I going to tell my family? Do I tell my coworkers or my boss? And there can be a real sense of a loss of autonomy. You know, we're adults, we are in charge of our lives, and now we have this scenario where they're saying, oh, you have to be at the doctor on this day, even if you work, or, you know, we have all these appointments. And so some things to help respond. I think throughout this whole thing, it's important to think about what has helped you cope in the past. So what has helped you get through difficult situations before? Can we employ those skills to get through this? Gather information for yourself and kind of know yourself. So it's important to ask questions to your medical team, you know, keep a notebook. I'm sure you've heard that. But also know who you are. So am I someone who wants to know every single possible side effect and every scary detail? Or am I someone who really wants to just put trust in my medical team and go from there? Or do I want all that information so I feel like I'm making my best choice? Building a support system. So that may mean getting second or third opinions, even if that just brings you back to your first doctor, but you're feeling validated. Family and friends, know who you can trust and who's going to be there for you and not add more stress to this experience. And again, finding a community within your diagnosis. When we get to the point of treatment, what's going on? So now we've kind of got things settled. We're actually getting our care. We're having to take time off work. Again, going back to the medical bills, we have concerns about bills. We have concerns about, again, taking that time off work. How am I going to pay for all these new things, these prescriptions? We may have outward changes. So if you have lost your hair, or if you're using a walker or a cane or oxygen, things like that. Some people feel like you fall into a routine of treatment of like, okay, I know I have to come every 3-4 weeks, whatever it is. And some people experience feeling isolated during treatment. So what can we do when we get there? I think first and foremost, use your resources. again, this is your first time going through this, and it's a very stressful situation. You are not on your own trying to navigate all of these things. So a plug for your medical center social worker, talk to them. They may be able to help you with a variety of topics, tell you what your medical center has to offer you. But I also always mention Triage Cancer and Cancer and Careers. They're just two amazing organizations. They can tell you about any legal or social issue related to having cancer. Cancer and Careers is exclusively an organization that helps people who have cancer and a career. And they help caregivers too, just knowing your rights. So definitely look into those. But yeah, like different financial assistance programs, different disability options. You shouldn't just know those. So you want to reach out to the people who do. In terms of communicating needs, I think that can help with addressing some of the isolation. So our friends and family might say, oh, reach out if you need anything, and then you don't hear from them. So it's okay to say, hey, it would be really helpful if you could pick up my groceries, or if you could give me a ride to treatment on this day. Being specific gets your needs met. It tells them what you need, and then they can feel like they've helped you out. And again, as you can see a theme, lean into your mesothelioma support. So moving into survivorship and cancer as a chronic illness. So, knowing that you have a disease that doesn't have an immediate cure is not always the easiest thing to come to terms with. We have to focus on living day to day, focus on the now. Some people might have fear of follow-ups after treatment is over. I also heard someone kind of mention that or reference that earlier. It may be stressful to be back in the same place where you got your diagnosis or got your treatment. And people also mention just ongoing decrease in support. You know, a person who's not going through cancer might think, oh, your chemo's done, great, you're all set, like you're back to normal, and that's not maybe the case. Has anyone heard about scanxiety? Yeah, so scanxiety is definitely an important topic that comes up. So it's scan anxiety. Lots of the symptoms are the same as anxiety, like we talked about before, but it's just the fear and the stress related to getting a scan, typically before you get the results. So before the scan, you know, obviously you're thinking, or you could be thinking, what's going to happen? Have I recurred? It's taking you back to that initial diagnosis time. During the scan, it just might be uncomfortable. You know, you're on this hard bed. You might be in a weird position. It's cold in there. Sometimes you're closed in. So that's not comfortable. And then after the scan, again, you're just worrying about those results. So some tips to manage scanxiety. Before your scan, try to schedule it in the morning if you can. I know that's not always possible, but that way you're not worried all day. And if there's anything like you can't eat or drink, you're not going all day without it, adding to your stress. Ask your medical team questions that'll help you feel prepared. So maybe you want to know, do I have to get undressed? Am I going to have to not eat or drink? How long might I be in the room? That way you're feeling empowered when you go in, you know what you're getting yourself into. Sometimes if we're really struggling with anxiety before a scan, that's okay. Your doctor might give you some medicine to help you kind of calm down. So you can always talk to them about that. And again, just sharing your feelings. Don't keep it all bottled up. During the scan, talk to the person giving you your test. You may be able to practice some of the mindfulness activities we talked about, like the breathing. If you can't do breathing, maybe you try your meditation skills. Sometimes they can play you music, just different things to help you relax. Bring someone with you. You know, they may not be able to be in the room with you as you're getting your test, but knowing that there's going to be someone in the waiting room for you after can be really reassuring. After the scan, try to follow up with your medical team. I know where I work, a lot of times people can see their doctor in the same day, so it's not super drawn out. bring someone with you if you want someone there to get those results. If it can't be the same day, try to keep yourself busy, stay on your routine. Don't let it get you, too bogged down. In the chronic illness stage, we also think about death anxiety. So I think it's natural for anyone to think about death, but certainly when you have a serious cancer diagnosis, it can come up. Some ways to work through that are engaging in normal death-related activities. So even without a cancer diagnosis, as a social worker, we should all have power of attorney documents in place. We should all have wills in place as adults. But if you haven't, that might be what's causing you some of your anxiety, knowing, oh, I have to get my things together. So work on that. Other people will try to do different legacy projects so that your family has, important things or ways to remember you. Like some people will film videos for their family. Some people are more artistic and they want to do scrapbooks or handprints. We see these hand casts a lot. And again, just talk with your doctor and your therapist. They can help you work through it too. Some other ways to get help. So I can speak for our medical center at the University of Chicago. I don't do individual counseling with people, so I kind of help with more one-on-one interactions. If you have a specific question or if you're having a hard day in chemo, I can come up. But we have a whole team called psycho-oncology. So we have psychiatrists, psychologists, social work therapists who specialize in mental health as you're going through a cancer treatment. So definitely ask your medical center what they have or who they refer to. Other community organizations can be really helpful. So Gilda's Club is a national organization, but they have different clubhouses. So in Chicago, there's one here in downtown. They do so many amazing programs. So they have support groups, they have educational events, they'll have physical activities like yoga or mindfulness. It's for Gilda Radner, who is on SNL. So they have improv classes. They have so many things that you can really tap into. They're all free and they're open to anyone impacted by a cancer diagnosis. So patients, family members, healthcare providers, whoever. There's also lots of national and online resources. So the American Cancer Society, they have lots of tips. Immerman Angels, they're an organization that'll match you up with a peer mentor. So maybe they find someone with a similar diagnosis who's a little bit ahead of you in treatment, who can kind of be there and say, oh yeah, I know what you went through. I got the same chemo, stuff like that. Obviously, the Mesothelioma Applied Research Foundation, they have support groups. They have lots of helpful information on their website. So definitely try to tap into your resources, see what you can come up with. I think being curious and reaching out for help is the most important thing, though it may not always be easy. So that is my presentation. I don't know if we have time for questions, but if you have any and we can't, you can always shoot me an email. I'm happy to share these slides. I have some references to go more in depth on some of the things we talked about. Some of them are more academic journals. Other ones are just, more helpful tips on the breathing and the mindfulness and stuff like that. So thanks.
Did we have any questions?
Thank you so much, Stephanie. Wonderful presentation. Our next session, we will welcome Dr. Carol Parise from Sutter Health to present Into the Weeds, the role of cannabis in quality of life. Dr. Parise.
Thank you. Yes, I'm Carol Parise. I'm with a researcher from Sutter Health, which is a healthcare organization in Northern California. And I'm going to talk about cannabis for cancer, patients that are using it for chemotherapy and for symptoms of cancer. And I'm going to talk about the quality of life issues that they can help and maybe help. So the goal is to integrate cannabis with modern medicine. So rather than say, okay, I'm going to use cannabis or I'm going to use traditional medicine, we want to try to integrate it. But in order to do that, you have to know how it works and what it's best to be used for. So cannabis has been used for centuries in many cultures for cloth. It predates humans, and it's been used in Chinese medicine for forever. But William O'Shaughnessy in the 1800s was an Irish physician who pretty much brought cannabis to the forefront for treatment of epilepsy and rheumatoid pains. And at that point in time, Bayer jumped on it and created medications with cannabis to use in about a third of their marketed drugs for various reasons. And it was widely used before it became illegal in 1937 when the marijuana tax was enacted. But attitudes are changing. Cannabis is now legal in 38 states for medical use and an additional 24 for recreational use. So we need to talk about what cannabis really is, because you hear marijuana, CBD, THC. So the cannabis sativa plant contains multiple agents. So the tetracannabinol acid, the THCA, is a non-psychoactive product that's in all raw cannabis. And because it does not become psychoactive until it's heated and it converts to the psychoactive product THC, which is what gives you the high. CBD is short for cannabidiol, which is related to THC, but it's not psychoactive, and it usually comes from the hemp plant. So hemp is a type of cannabis that contains less than 0.3% of THC. And then when you hear marijuana, it's not synonymous with cannabis. It's a part of the cannabis plant that has the substantial amounts of THC. So there's multiple methods of delivery of cannabis. Smoking and vaping is what everyone thinks of recreationally. Edibles have become more popular because of the legalization. It's made into candies and all sorts of other products. And then topicals, rubbing on, and tinctures, which you put on your tongue, those are other ways that it is ingested. But smoking and vaping is the most, it has the fastest acting time because you're sucking it in, and the THCA is converted to THC, and the effects occur within 2 to 3 seconds and then can last 2 to 3 hours. Edibles are a little bit more variable in how they act because they can either have THC or CBD in different combinations, and the effects can be felt anywhere from 30 minutes to 2 hours and may last for 5 to 8 hours. But the issue is you take it and you might not feel anything right away. You might take more, which could lead to taking too much. And topicals and transdermal patches are even more variable because it depends on where you put them on your body and, again, the ratio of THC and CBD in the products. So the reason patients with cancer use cannabis tend to be to counteract the effects of chemotherapy, which include nausea and vomiting, pain, anorexia, sleep, and anxiety and mood problems. But the research on all of these isn't particularly strong in some areas. Some is better than others. So that's what I'm going to get into. I'm going to talk about the different studies on use of these products for these different issues. So there is evidence for cannabis use as an antiemetic. So in a multi-center randomized double-blinded placebo-controlled trial, which is like the gold standard, this was a crossover study. Patients were given the THC CBD product or given a placebo, and then they swapped out. And then they were measured on their vomiting and their complete response, not having to use the rescue medications. And when they had the CBD THC product, 25% had complete recovery. They had no vomiting, and they did not need to take their rescue medications. In the placebo group, 14% had that. The other interesting piece of this was that at the end of the study, they were asked, would you rather what you had the first go around Or when you swapped over, would you rather have that product? And most of them said they'd rather have the THC CBD product. So that's a kind of a push in the direction that, hey, this might work. The other key piece of this, though, is they all had their standard antiemetic drugs at the same time. Those were not eliminated from their standard of care. So there's a synthetic cannabinoid medication called dronabinol, and it's FDA approved as an antiemetic, but it's not as effective as the standard of care antiemetics. So it's generally not prescribed. And the NCCN guidelines don't recommend cannabis for treatment of chemotherapy-induced vomiting and nausea, but ASCO kind of takes a page from the study we just looked at. They say, hey, dronabinol and nabileone, which are both cannabis-based products, could potentially be used to augment your standard of care medications for nausea. So pain. There's insufficient evidence to show that cannabis can reduce pain. But what it has been shown is that it could potentially reduce the amount of opioids that people are using. And there seems to be a sweet spot where if you use too much, it makes the pain worse. And so one of the biggest studies on this was 38,000 patients with newly diagnosed breast cancer, colorectal cancer, and lung cancer. There was in a state that went from no legal cannabis to legal cannabis, they found that there was a reduction in opioid prescriptions and pain-related incidences with newly diagnosed cancer patients from the time it was not legal to the time it became legal. So there is evidence that it could potentially reduce the amount of other pain medications being used. So anorexia, you would think, based on social, that take a hit and you're going to eat everything in the room. The interesting thing is in the systematic studies where people looked at all the studies on cannabis and anorexia, there wasn't a lot of benefit. There was not enough evidence to show that this really worked. And that's when they used megestrol as a comparator, which is the standard of care medication for anorexia, or a placebo. So these were high quality trials, but the evidence was really limited and they had small sample sizes. So the largest study that kind of shows this might not be the best thing for anorexia is in 469 patients with advanced cancer. And they were randomized to either receive a cannabis product, which was dronabinol and placebo, or megestrol, which is the standard of care medication. And the megestrol group reported greater gains. So it's not really been shown to be very effective for making people eat more. Now, sleep aid is another thing that you would think would be, hey, this stuff works. Everybody has CBD gummies now. It seems to be the thing. But in all of the studies out there, there's not a lot of evidence to show that it's really effective for helping with sleep, even though there is widespread use. Anxiety's got a little bit more beef behind it. So in a 10-patient trial of patients with anxiety, a single dose of CBD lowered anxiety on a CT scan. So that's a fairly solid endpoint. And it was only 10 patients, but that's a pretty solid endpoint. And then in a double-blinded trial of patients with social anxiety disorder, a 600 milligram dose of CBD was able to reduce subjective anxiety induced by a simulated public speaking event. But I think the best study that shows it's got potential for anxiety, and it might have to do with the makeup of the product, was done in Colorado. And so it's legal in Colorado. And so they found 317 people with anxiety disorder who also used cannabis just in their everyday life. And they randomized them to 3 different groups. One with a THC dominant product, one that had half THC CBD, and then one that had more CBD than THC. And at the end of the day, the CBD dominant forms of cannabis were associated with acute tension reduction. So this seems to have the most promise. So why don't we have more research on this? And it's because it's illegal. It's a Schedule I drug, which means that there's no current acceptable medical use at this time. And so it's like it's got a high potential for abuse, which is like heroin and LSD. So research requires approval from your own institution. You've got the DEA, and you probably have an IND because that's the FDA. And then it has to be the product you use. You can't just go down to your local dispensary and say, hey, you guys want to collaborate on this study? You give me the product, we'll do the research. You can't do that. You have to use an approved researcher synthesized product or get something from the National Institute on Drug Abuse. And if you want to do research on cannabis and you don't have a safe in your office that's in the wall, you need a 750-pound safe, a $300 DEA license that's going to last you 3 to 14 months, and it takes 95 days for that process to happen, just the regulatory process for the DEA. That doesn't include your IRB and your FDA. But times are changing. It looks like we may have a potential that we can be doing more research on cannabis. Just this last May, the Justice Department suggested a move of cannabis from a Schedule 1 to a Schedule 3. Schedule 3 is like a moderate to low dependence, like ketamine and testosterone. And the 2018 Farm Bill, so that says you can do research with cannabis that's less than 0.3% THC. But the kicker of this is that when they introduced this bill, you are required to use a DEA licensed lab in order to test to make sure your product had 0.3% or less of THC. So that it overwhelmed all the labs. They got rid of that requirement because they can't keep up with it. So I think we're going to see more CBD research ahead. So that brings me to a study that I did with my colleague Deepti Bell, who is our research medical director. And she and I put together a study several years ago because we wanted to know what patients with cancer were using cannabis. Who were they, and how did they use it? How much did they spend, and did they really find out that feel like it worked? So the population was the Sutter Cancer Center in Sacramento, and then 12 other cancer centers across Northern California. And then we also enlisted UC Davis Medical Center, which is about 4 blocks from our office. So patients were given the option of completing a survey in the waiting room before they were having treatment. And they asked whether they used cannabis, yes or no, and we wanted to know the differences between the people who said yes, the people who said no, and the people who said yes, we wanted to know about the reasons for use, how they used it, and did they feel it was beneficial, and how much did they spend on it? So we started out in 2017 where they just completed a paper survey. COVID happened. Suddenly we got into QR codes. So we put the QR code up and we were able to expand the study because we could just go in the office, push the QR code, and people could fill it out online, and then we didn't have to do the data entry, which was nice. So when we looked at the users versus the non-users, we had a good population of people. And it turns out that the users were younger. They were less likely to be Asian Pacific Islander. But we didn't find a race ethnicity that was more likely to use it. Patients with brain, gynecological cancer, prostate cancer were more likely to use than not. And those in stage 3 and 4, and those who are undergoing chemotherapy were more likely to use cannabis. So when you put all these variables together, we wanted to see what really stuck out. So we adjusted for all the other variables in the model. And we still found that younger people were still more likely to use cannabis than older people. And that Hispanic, Pacific Islander, Asian Indian were less likely than any other race than whites to use it. And all the other races were very similar in use to white people. And stage 4 cancer still stood out, and those with chemotherapy also were more likely to use. So the reasons they used, of all the 625 users, over half stated they used it for sleep, and 46% said they used it to reduce pain and anxiety. Edibles and multiple methods were favored by over 60% of the people, and 68% when you combine the vaping and the smoking, either vaped or smoked. So our big question to them was, how did you feel like this helped you, or did it help you? So on a scale of 1 to 10, we asked them, of each of the symptoms, how bad was this particular symptom before you used cannabis, and how bad was the symptom after you used cannabis? And it was on a scale of 1 to 10, and then we compared the before and after. So if you look at the results, the blue is the before line, the orange is the after line. And in all cases, these are all really statistically significantly different. But the pain, the anxiety, and the appetite all stood out as being the largest differences. But they didn't spend that much, which surprisingly, I thought they would be spending more on this, but most of them spent $100 or less. And then after that, it was $100 to $200. So conclusions, younger patients with higher stages of cancer with chemotherapy are more likely to use cannabis. Most used it as a sleep aid and vaped, smoked, or used multiple methods. And despite the lack of overwhelming evidence, patients reported it was most effective for decreasing nausea, pain, and increasing appetite. But it was a biased study, and you're going to find this in most of the studies out there, is that when people buy their own cannabis and they're more likely to say, oh yeah, it worked. There's just a natural tendency to want to think that what you spent your money on, it was really helpful. So we know that. So considerations for use. Now that we know all of this, the question is what do you do with the information? And the first thing to realize is addiction is still real. And if patients with personal family history or themselves of addiction shouldn't be encouraged to use that because it's not good. And there are a lot of side effects. Tachycardia, orthostatic hypotension, confusion, obviously you shouldn't drive. And a study of patients without cancer found that there's liver enzyme damage just in patients who were taking 300 or more milligrams of CBD per day. And patients under 25 years old should be discouraged as the prefrontal cortex isn't fully developed until age 25. So some studies have found that use by adolescents is associated with decreased cortical thickness. So what happens when someone says, hey, I really want to try this? The recommendation is to start small. Like 3 milligrams of THC equivalent is a reasonable place to start. But inhalation is more predictable. I mean, you don't really encourage someone to go out and smoke, but if you want to know if it works quickly, that's the way to do it. And if you take edibles, make sure you gotta wait 4 hours or so because you may not have an effect. And you'll take another and then you're gonna be not good. So there's a lot of drug interactions too that you have to be aware of, that it increases the level of other drugs. So patients that are on warfarin, seizure medications, statins, erythromycin, if you don't know that, and you need to know that that people are taking these drugs if you're going to use cannabis. So again, the final word then is to encourage discussion. So a small UK study found that people use the complementary therapies based on sources of information that they have, what they hear, what they may see on TV, their friends, potential mechanisms of use. But a belief in the trust in the therapies of their caregivers is also another reason that they may or may not use something. So it's important to discuss with your doctors, and the doctors need to discuss with the patients. Because patients are using them. Regardless of physicians' attitudes, 80% has shown, some studies have shown up to 80% of patients with cancer are using complementary therapies, but they're not telling their physicians, which could lead to side effects. So the ASCO guidelines suggest that clinicians routinely and non-judgmentally ask patients, are you using cannabis? Have you thought about using cannabis? Just so to make sure that they're willing to discuss that with you, because if not, that's when you're going to end up with too much warfarin or too much of or orthostatic hypotension. So that's all I have. So do we have any questions? Yes. You must have a reputation.
Well, one or two things you didn't. 20-something years, and we smoked before that and afterwards. We also found, once it became legal in the state, she went to see a doctor, nurse who would prescribe it, and had a nice discussion because she had some cancer issues also. And she said a particular plant to buy or weed to burn. We found that, and we found the one brand, not the one brand, but the one plant, particular name, did wonders. we found other ones didn't do anything. So that seems to be a bigger problem when you go to the gummies and so forth, because you're getting combinations of many plants and so forth. What we also found out with the 2 plants, and she stocked up on them. She passed away a year and a half ago. I still have stuff at home that we stocked up on because they stopped growing the plants, because the plants weren't producing enough leaf for them to manufacture, so they go after the bigger leaves that they're producing out there. So, and I could go on, and we can have some nice discussions. Where you're doing all this research, are you also taking particular plants and not just CBTHC? There's difference between plants because of the chemical analysis of the THC that's in there and the CBD, and they're still finding other things in certain plants depending where they're grown, what chemical mixtures or so forth are in there. And I could probably go on. I hope everybody hears it, and I'm curious of your answer and why they don't go for the plants yet.
You nailed the problem with the research. And that's the one thing I noticed in all of these studies that you look at. Nobody talks about that. And part of that is the difficulty in doing the research and having to use a standardized medication, the dronabinol and the nabilone are the ones that they can do the research on. They're not doing them on the particular plants, and that's what we need in order to find out if this really works. You need the type of plant, you need what's in the plant, you need where it's grown, the strength of exactly. And so that it's in growing variability. It's just like wine. I mean, you've got when you have different locations, are going to make a different plant. And right now, it's too difficult to do the research because you can't just you can't do it if you don't. The money, for one, the government can't fund the research. If you're going to do research on cannabis with government money, it has to be a survey type question. It can't be we're going to provide you with a cannabis drug. So that is, you nailed the exact reason why it's so difficult to say when this works and how it works, because the compounds are just also different.
And I would suggest, I hope everybody hears me. I can talk loud. I get out there. But I think if anybody's going to try the smoking, depending on, if you have plural, it's rough with the lungs and everything, and there's other ways of getting leaf smoke into you that's a lot cleaner and so forth through certain burning methods, which I think is good. But try a variety. One of the things we found with gummies was we had them imported from California, was 20 to 1 ratios. 20% CBDs, 1% THC. Yeah. They also have the reverse, where I find some people go take it. Oh, I got a CBD, and shit. Yeah. Right? So that's where you have to look at combinations and look at things. And now, anyone who wants to talk later, no problem. Thank you.
Hi, I'm a fan of medical marijuana. My husband used it for sleep especially, but I was hoping you could take a minute to just debunk some of the things that are out there, because I think cancer patients are especially vulnerable to scam cures, and one of the ones that I hear about a lot, my brain wants to call it Rick Steves oil. I know it's not Rick Steves, he's the Europe guy, but it's something along those lines, somebody's oil. And if you could just talk about what products specifically to avoid.
So I can't talk about which products to avoid, but what I can do is tell you to go to PubMed. If you are going to use a product, if you are looking at it, do your research, because you are right. There are so many. I was looking into some complementary therapies for arthritis 6 months ago. And when you look at the studies that are done, a lot of times what they're doing is they're taking the results of animal studies and they're generalizing them, an injection in an animal, and they're saying, okay, this is going to work as an oral supplement in humans. And somebody markets that. There's no regulation of those products. So my suggestion, there's a natural medicines database. You have to pay for it, but that is one of the better sources of information. It tells you whether or not something, how much evidence is out there for a specific product, and whether or none. And you'll go down, you'll see none, and suddenly they'll say, oh, this particular product, there is some. So I think that's your best bet is to PubMed. Don't just Google. You start with Google, and it's going to give you every ad you've got and every product out there. That's how they're selling them. So that's my suggestion, is that I can't specifically debunk which ones do and don't work.
Pardon me. Has your research addressed, there are some who would argue that cannabis or marijuana is an entry-level addictive drug that could lead to more dangerous, more dangerous drugs in addiction. What does your research show if that's true or not, or especially within a cancer community?
It's shown in patients who have a family history of addiction or a personal history of addiction. But I haven't specifically looked at patients with cancer, any studies in that area. But the family addiction and the personal addiction, if you have been addicted to anything, alcohol, anything like that, there is an association of addiction across types of products. So if there's an alcoholic involved, then you're probably going to be likely to be addicted to cannabis also. And is it a gateway drug? Could be, but not in everyone.
When you guys were doing your study, did you guys take into account, especially in California, the people that were home growing and how much they were spending monthly on their cannabis use? So the people that were growing their own plants and making their own gummies, and then kind of looking at how much they were saving in prescription cost for opiates versus people who were just using opioids for pain management, and those who were using homegrown THC and opiates to kind of offset that cost and what the savings was on insurance companies and on the patient overall?
Yeah, no, we didn't look at any of that. And one of the reasons was that if we wanted to hook patient prescriptions up with the amount, with use or no use, and ask those types of questions, we couldn't anonymize the study. And so we anonymized this. So there was no names or PHI on anything that we got in the surveys. But I like that idea. That would be great to be able to determine. So again, the opioid prescription reduction, and then in California, most people are yeah, yeah, yeah. It's interesting. We have a very good dispensary near our hospital that we've talked to. And, that's the other piece of it, too, is you've got to find someone you trust. If you're going to go to a dispensary, you want to talk to people who know what's in their product. They want to know where you're getting it. Those are really important to know, because you don't want somebody who says, oh, yeah, this only has 5% THC and it's 24% CBD, and it turns out that it's the other way around. You want to know what you're taking. And that's half the reason that one of the reasons that we don't have a lot of answers on whether or not this works, is that you just don't know what's in a lot of the stuff you're getting.
I had a question as it relates to immunotherapy. Mm-hmm. Your study's obviously focused on chemo, and I've gotten advice from my doctors that on immunotherapy, it can actually suppress immune system, THC, and just what your thoughts are, if there's been any research or studies.
This is one where I wish Dr. Bell was here. She is our oncologist that could tell you a lot about that, but I'm not qualified to talk about that.
I think that's where you say that speak to your physician before
this is where you want to talk to your physicians, and if you've got more than one, you can talk to, see what where you get multiple insights on.
There's been guidance on that with ASCO though, and so I think the best decision for anybody is, I'm not a physician so I don't give advice, of course, but for anybody who's on active treatment, you should always speak to your physician before taking any type of integrative or alternative herb, supplement, medication, anything like that. And this falls under the same category.
If not, tell them to boost up your treatment while you're smoking. It works.
I'm from California. My brother grows plants. There's a dispensary that is working with me. Purplicious, the strand that they suggested for me for pain. I hate taking Oxycontin. I hate the fentanyl patch.
They can't hear you.
I'm on fentanyl patches and Oxycontin. I don't like taking those drugs. My brother grows plants. He works with a dispensary that they suggested purplicious plant, which is for pain. Okay, this I've been on it for so long, and it helps me. It does help me mentally, because of the pain is so, you're on edge, and you can't function because you're concentrating on that pain. But it helps me, and I'm staying on this. And my doctor, all my journey, he does not discourage us. I can't do the gummies. I pass out. Point blank. I like the smoking. I can't do it either. But I do the vape. And it's like, that's it. I'm cool. Yes.
And that's what it comes down to, the plants.
It does. It comes down, yes.
Any other questions? Okay, thank you, Dr. Priest.
Thank you.
Do you want me to pull this up first? Do you want me to pull up the... Okay. Thank you to Dr. Paris. That was such a good topic, and I know our community advisory board was adamant in getting that topic talked about. So we're very happy that we were able to get Dr. Paris here, and thank you to our patient services director, Julie White, for making that one happen. We are now going to move into a new portion of the afternoon with some panel discussions. So these will look a little bit different than what we've been doing with the regular presentations and speakers. And so our first panel will be Family Matters, talking to your family about your diagnosis. Please welcome up our moderator, Beth Flansbaum, Shane Smith, and Claudine Benmar. Beth, if you want to be here, or if you all want to be at the table.
Can everybody see us if we're over here? Is that going to work?
I think if she stays.
Whichever makes the most sense. So, hi everybody. I'm glad to be here. For those of you that don't know me, I'm Beth Flansbaum. I'm a social worker, and I used to work at Brigham and Women's in Boston in the International Mesothelioma program, where I spent 7 years supporting patients and families through this disease. And one of the things I've learned in the course of my work is that you cannot do this alone. That
the most successful outcomes that I've seen happen when people have large support networks and rely on those support networks. And I really spent a great deal of time working with families and caregivers. So, and my personal belief is that this disease affects everyone who it touches. And so I'm really glad to have two people who are going to speak about the effects of the illness on their families. They're each going to introduce themselves, and then we're going to open the floor up for questions immediately about how they've handled their illness and their families. And we have some other talking points if people's questions sort of die. So, Claudine, do you want to start?
Hi, this is like the second time I've introduced myself today, so you probably already know who I am. But I'm Claudine Benmar. I'm from Seattle. My husband, Pete, had peritoneal mesothelioma. He passed in January 2019 and was diagnosed in November 2016. We have two daughters. They were 13 and 16 at the time that he was diagnosed. So we had a couple years of dealing with it as a family, including two relocations to a different city for treatment. So I am happy to talk a little bit about that, or just how we, brought up the idea at the beginning with our kids, as well as I'm happy to talk about kind of our communications as a couple as well. So.
Thank you, Claudine. Shane?
Here we go. Get it figured out. My name is Shane Smith, and I was diagnosed on July 18th of last year. And it actually had taken us a couple of months to get the results. I had a prostatectomy before. It took about 2.5 months for them to figure out that I also had mesothelioma. And so then, that kind of put us on this journey that we're on now. And I have my wife's here, Allison, and we have 3 kids, ages 27, 24, and 19.
So I wonder if it makes sense maybe to start talking a little bit about what it was like to tell your children. And I don't know if people have any questions about that process.
I'll go ahead and start, because I distinctly remember that the strategy we used at the beginning was to try as much as possible to stop them from Googling mesothelioma, just because the information that's out there is very scary. And so I think that at the beginning we just said, Dad has cancer. And it's a serious cancer, but we're looking into treatment. And I also remember that at the beginning, one of the things we did was go through all the people that were close to us in our lives who we knew had been diagnosed with cancer and had successfully treated it, so that they could think of it as a treatable condition. It was important for us, especially at the beginning, to make sure that they felt like this was a problem that our family was facing, but that we were handling it.
I'm just curious, at what point did you decide to tell your children?
Oh, I mean, about the cancer in general? Yeah, I mean, right away, because, our older daughter, no, they were both home at the time. So, yeah, I mean, it was pretty much the first opportunity that we could all be together in person. We told them.
Thank you. Shane?
So I got my diagnosis at like 4:00 on a Tuesday afternoon, and it was, obviously it's very disorienting when you get that information, but one of the main concerns coming out of that is, how are we going to tell our kids about this? And so we waited a day or two before we actually broke the news to them. And my 2 older daughters, they're out of the house. My son lives at home with us, and we called our daughters eventually, and then I told my son in person. But I think one of the challenges in all of that was, like, I'm not a super emotional person, so I wasn't crying over the diagnosis. I mean, you felt like a bomb had gone off, but also you're trying to figure out how do you manage this from kind of your own world, but you're also trying to manage how am I going to control their emotions as well, and because you feel a responsibility for the weight that they're going to have to carry from this. And so that was one of the struggles that I had early on, was just how do I manage not only my kids' emotions, but then friends, and everybody comes up to you and they have different reactions to your, telling them that you have mesothelioma. And so for us, what kind of changed in that whole process was, it was actually later on when, right before I had HIPEX surgery, we had met with a surgeon, and he had come back with some, saying it was much more advanced than what he thought it would be. And he was kind of listing out worst case scenarios. And so my daughters were in that appointment. We came home and we were sitting around the living room, and my oldest daughter just broke down and started crying. And was like, I don't feel like we're talking about this. And she's like, you're just not showing much emotion. I feel like we're not dealing with this. And so then we all just cried. And it was kind of at that point, I think there was a turning point, at least in my mind. It was, I don't have to manage their emotions or manage everyone else around me. I can just go through this process with them and grieve, and we can walk this together, instead of me trying to feel like I've got to juggle my own cancer, I've got to juggle this diagnosis, I've got to juggle the emotions of everybody. And at some point, it was at that point where I felt, okay, I can just kind of lay that stuff down.
Great, thank you. How did you both determine who you were going to tell within your support network?
I think immediate family, came first. I didn't tell friends until we were, until it was, well, I told close friends immediately, but sort of my local friends, my friend group that, became the meal train and all of that, I literally went for, 6 different walks individually with friends to tell them, that we're about to go to Omaha for a few weeks and we won't be around. It was, I think I was doing those walk and talks up until like right the day before we left town. So yeah, I guess once you get beyond immediate family, it sort of felt like a need to know basis. And they needed to know because we were not going to be in town. Part of that was driven by, my husband was just a very private person, and so respecting his comfort level with wanting to broadcast it to the world.
Yeah, we started off with kids, family, close friends, and just kind of went out from there. And then eventually, I don't know, maybe it was 3 or 4 days later, we kind of made a broader announcement just on Facebook or whatever, and set up a caring bridge. But yeah, it was just start off small and then kind of grew from there.
Is there anything? I'm sorry. Go ahead, Claudia.
Sorry, I was just going to say he never posted anything on Facebook about it. So, and we did a site. It was called Rallyhood. I don't even know if it still exists, but it was basically a caring bridge equivalent.
Well, I think in posting it broadly, we weren't prepared for the onslaught of messages, and actually she managed most of that, but it became quickly overwhelming, just the number of messages and the feeling that you've got to respond to all of these messages, and it kind of adds another layer of just stress in the whole situation.
Yeah, for sure.
I've heard people talk about how re-traumatizing that can be, to have to keep repeating things over and over again. Is there anything you would have done differently, both of you, in terms of talking about it with friends and or family?
I actually asked my daughter after the fact, my older daughter, and she at first said, well, you guys had some indications because the surgeon had alluded to the fact that it may be mesothelioma before I got my official diagnosis, but he's like, it's a long shot, probably not. And so we kind of thought, well, maybe, but then when we told them, we didn't really tell them the severity of it. And it's a difficult thing to juggle, because you don't want to be completely pessimistic and say this is, this may be the end result, but you don't want to gloss over it either. And so she said, I wish you would have been more upfront with us about what kind of the severity of the disease. But then later in the conversation, she was like, well, also it's probably good you didn't. So I don't know. I think, and I think you just have to kind of give yourself grace in that situation, because you're doing the best you can. And, we're going to screw up sometimes how we tell people or how we manage this or how we process emotions. But, I don't know that there's anything I would have done different necessarily. But
I would say the same. I think that in order to try to make everything seem manageable, we also maybe downplayed the severity of it. But because it happened, over the course of 2 years, we gradually got more and more communicative about the scope of this beast that we were facing. I think they were, ready by the time treatment ended. I don't know. You get a lot of people wanting to come visit, and I didn't really have a good system for dealing with that or knowing what to say. And so I feel like I wish I would have been a little bit more prepared for that.
I've often encountered people who, and we've sort of touched on it, about people asking what they can do to help, which I think many people in this situation find very frustrating. So how did you manage that question of what can I do to help?
I let Allison answer those questions.
It's the worst. It's just so what's terrible about it is I find myself doing the exact same thing when somebody I know is struggling. I was like, let me know what I can do to help. And I'm like, I hated it when people said that to me. But I guess I keep in mind the people whose help I appreciated the most, and I try to model myself on their example. One of my friends said, you're going to have a lot of people wanting to visit you. Like, we have a spare room and a spare car. They're more than welcome to. And that was just a wonderfully specific thing to offer. I did tell people that I would want to go on walks. And so, I had all sorts of people coming and just saying, let's just schedule a walk for Tuesday at 2. And, just kind of wanting people to take initiative instead of putting the burden on me. But that's just in terms of how I have learned to be a better support system for others. For getting support for myself is just learning how to say yes to anything, any offer of help.
Yeah, I would agree with that. The people who were the most helpful were the ones that knew that we needed something and just said, hey, I'm going to do this or I'm going to do that, instead of just the broad question of what can we do to help.
I'm so glad you said that. I also encountered people, though, who are hesitant to accept help because they don't want to put people out. And I've struggled with that many times and often said, if the shoe was on the other foot, what would it feel like for you to have your offer of help rejected? Because I think that for many people who are used to being in charge of their lives, to suddenly have such a change occur, it's hard to sort of go into a receiving role rather than a giving role. So, before we move on to other questions, does anybody have any comments they would like? Oh my goodness. All right, who's in charge of the microphone?
Yeah. Who raised their hand? I'll start here. Is it on?
Claudia, you mentioned that your family... Claudia, what?
Claudine.
Claudine, I'm sorry. Okay. You mentioned that your family relocated multiple times for treatment. and I would be interested in learning more about how you did that, how you decided to do that, because you're moving children and changing schools. Like, were they long-term moves or?
No, it was made much simpler by not including the kids in the but that was complicated by we had to find people who could stay in our house with them so they could stay in their own schools. But yeah, he had 2 HIPEC surgeries with the wonderful Dr. Jason Foster at Nebraska, so each time was 5 weeks total with the surgery plus recovery time. We moved into an Airbnb, and his parents were with us for much of that time, both times. But the kids stayed back in Seattle and stayed in school, and then we had the other grandparents stay with them in our house. But I had family medical. Well, I think we both used medical leave for that time. We didn't try to work remotely or anything.
Hi guys, I just wanted to say, first of all, thank you for sharing your stories and your side of it. My name is Mackenzie. I lost my dad to mesothelioma, and so I kind of feel like I can give the child's perspective a little bit on receiving that information, and I'm really sorry. Something I found extremely helpful that my parents told my brother and I. They set expectations for what the future could look like and what my dad was capable of doing and what he wasn't capable of doing. And I was very grateful for that, because there were certain things that I think normally my brother and I would expect both of our parents to be able to attend and to be able to do. And after his diagnosis, that wasn't the same. And so going into a family vacation, for example, that we wouldn't be able to go on hikes, or that we were going to need to bring my dad's oxygen tank and we needed to know how to use it, and that we might not be able to stay for the full time. Those were all things that, even though they might have been hard to hear in the moment, it was extremely reassuring to know, because we had kind of the knowledge going in that might be a possibility. And so while I haven't experienced it myself, I wanted to just share that was really helpful for my brother and I. And I appreciate you guys sharing your sides of it, because it's very wonderful to hear that. And thank you.
Thank you, Mackenzie.
Thank you.
I have a question. Did you educate, because this is a rare disease, did you educate people first to let them know, because the scanning, the PET scan, you see, it's a continuous cycle. Did you educate everybody first so that they can understand where you're going through?
I'm trying to remember. I don't think that we did a lot of education. I think we just kind of announced it. I mean, we told our kids probably a little bit more, and then let everybody else just Google it. So maybe we should have provided better guidance around some of that, but I don't. Yeah, and a lot of it true, and that was part of the other thing, is that a lot of people say what's next, and early on you don't know what's next. Like, we were getting second opinions, and so just trying to, I don't know, it's just so hard to navigate this on so many layers.
I'm curious, because you guys both had different experience with social media, with one posting on social media and one not. How did you guys manage, or if you even experienced kind of the information overload, having to tell all of these people and the fatigue of I have this group of people and this group of people and everybody coming and asking all of this, and kind of setting those boundaries and managing your own and insulating. I mean, I have 3 adult children, and trying to insulate them and protect them, and managing myself and my husband, and this whole other world of being bombarded with all of the questions. And
yeah, and I think that's the goal of having one of those sites like Caring Bridge. I'll just say Caring Bridge, even though that's the one we didn't use. My husband hated that name for whatever reason. He was just like, nah. that's a site like that is supposed to solve that problem. In real life, you can speak to your experience, but it didn't, because people still will text you individually. And obviously, members of your immediate family, your kids, your parents, those are just going to have to be individual conversations, even if you're repeating yourself quite a bit. Yeah, I mean, I guess in that way it was helpful that we weren't super public about it, because, the number of people who could reach out and text was very small. I want to hear your perspective on that exact question, but I will also say just that using one of those sites, I'll say that I felt a lot of pressure to only post good news updates. And for me, that was not, it kind of defeats the purpose, because you should be able to do updates whether they're good or bad. But I just wanted to only say happy news, and then it's not really serving its actual purpose. So.
Yeah, I think one of the hard things about posting it on a public level is all the feedback and recommendations you get. Like, try this, try that, and it's just like, okay, dude, like, if we need help, we'll reach out for it. And there's other people that are very valuable resources in that too. So I don't want to diminish some of those things, but when you ask for people's help for something, people that aren't qualified to have, to have input into some of this stuff come up with some pretty crazy things. And so I think one of it was just the overload of people, just encouragement, messages, all that kind of stuff, but then also was kind of just filtering through some of the information and trying to nicely move on beyond some of these other recommendations. So it's kind of a mixed bag, but, in making it public, it did get us, some connections and resources that we needed that I don't think we would have gotten otherwise. And so I think you just kind of have to see what works best in your particular situation. For us, we have a pretty broad network of people, and if we had made kind of a broad announcement, then we would have been getting even more direct emails and text messages and all those kind of things. So.
Hi, I'm Linda. Oh, you can go ahead. There you go.
I'll just piggyback off what he said, because he doesn't know some of the stuff I did, because I did it.
You're the caregiver and the spouse, yes?
Yes.
Okay.
So I have no shame in writing a post and saying, please don't leave any comments regarding opinions or thoughts. We don't need any recommendations. I know you mean well. Also, during this time, I'm not planning on answering texts, so thank you so much. You're welcome to text and support us, but I won't be answering. And like when he was in the hospital, please no visitors unless you're invited. Like, I don't care.
So let me ask you something. Were you always such a good limit setter? Or did this diagnosis get you there?
She's pretty good at setting limits and speaking her mind, and it helps that she's medical as well, so that she was a huge advocate in that regard.
Hi, I'm Linda, and this is a new journey for us. It started in December, so it was really easy at the beginning for our family and our friends to get it, because he was having surgery and there was a recovery period, and then he had treatment. And then when you're in like the waiting game or trying to determine, you're going from scan to scan and trying to figure out what to do next, like I still feel like I need support, but I don't know how to express to them that this isn't like a regular cancer. And how did you kind of navigate that when it wasn't like an obvious need that you, like, I don't need meals right now, but do you know what I mean? Like, it feels kind of, but people kind of drop off and they don't know really, I don't know. It's just complicated, more complicated than I thought.
My main response to that is just that's when you reach out to your people here, because they do get it and they will be here for you. Otherwise you do spend a lot of time educating your friends and having expectations of them that may or may not be realistic, but your meso community is here.
And each time like people sometimes know that we're having a scan, and then the next day they say, how is the scan? Like, how do you deal with that, whether it's not so great or,
Well, to my knowledge, I don't think we announce when my scans are. We'll just give an update later on. So we'll say, another scan will be in a few months, but we don't tell them specific dates. And then when we get the information back, which, it's only been a few scans since my surgery, but then we'll announce that, the scan was clear and, we're waiting for the next one.
Yeah, the number of people who knew our scan schedule were like in the single digits. So, and they were the people who could handle bad news.
Giving Julie a workout.
Hi, good afternoon, everyone. I'm a caregiver. My wife was diagnosed 5 years ago. I wanted you to kind of speak a little bit about the emotional aspect of it in terms of just how to deal with it with the kids, because we have 3 daughters and we have 4 grandchildren, 3 grandsons and 1 granddaughter, and we raised our grandson, and he's 15 now. So just how to mitigate some of the the stress and the emotion. How did you deal with that in terms of, just inside the home? Because a lot of things we keep, when I'm saying we're not super private, but we keep things within us as a family, and how do we, from day to day, because we do have to continue to go on and live, but sometimes did you seek out like some kind of counseling or, kind of other advocates, support groups or something like that? What would you suggest in terms of just how to work with within the family to kind of mitigate a lot of the stress that's involved with that?
So our family dynamics are a little bit different because our 2 oldest daughters are out of the home. My son, he's adopted, and so there were kind of another set of issues there because he'd already lost a couple parents. Now he's dealing with the potential loss of me, and so he has gone to counseling on a not regular basis but periodic basis as needed. And I think part of it is just to keep the conversation going, like pretty open dialogue and checking in, because he keeps things a little bit closer. But with my daughters, like we have pretty open communication, and so it's kind of like we don't talk about it all the time and we don't ignore it either. It's kind of like if it comes up and we want to talk about it, then there's kind of a natural conversation that takes place. But I guess we don't try to over talk it. We don't try to downplay it. We try to kind of land somewhere where it's just part of life, and if we need to talk about it, we do. And then if they need counseling, if they need support, then making sure that those resources are available for them.
It's a great question, and I don't know that I have a great answer for you, but I will say that just allowing emotions to happen when they do. Therapy is a great option as well. There are support groups out there specifically for kids. My younger daughter, I think, found a lot of help from a support group that we went to monthly, but then there was also a camp that she attended after my husband died, and I think there are also camps for kids with parents who are ongoing with cancer treatment. And I found that really, I think it's helpful for them to have somebody outside the family that they can talk to, because they might be worried about sort of like triggering big emotions within the family. And so for my younger daughter, really the main value she got out of going to that support group and the camp was having that one person that they became close friends, and she just felt like somebody my age knows what I'm going through, and they have a good bond. So it wasn't the group necessarily that helped her, but just the group provided her access to make that one friend.
I'm sorry, what? Well, I was just going to say that one of the things that impresses me about the 2 of you and everyone else who's spoken is sort of your acknowledgement that, this is a journey, and that the needs of family and of you all change depending upon what's happening at any given point in time, and that keeping communication open seems to be really important. I know that, though, for some families, that's not a value per se. And so I'm wondering, for anybody in the audience who has not chosen to share their diagnosis, if you could talk a little bit about that decision. It looks like Tanya. Tanya?
This may be a unique experience, but I have an 87-year-old mother and a 93-year-old father. And I was in the hospital for 10 days for surgery. And I'll never forget, like, wanting to stay in touch with them, and at the same time knowing how much they worry. I didn't want to share the details with them. So I was always so paranoid, like, that the alarm bells on, the IV would go off when I'm talking to my dad or something like that. But I made this conscious decision, and I know it's personal to everybody who they share with and who they don't, but not to share the details with my parents. And I've gotten more open with them now, but I think it was definitely the right choice at the time, because it would have just been, I think, devastating to them and incredible, and physically when they saw me, I was in New York, they were in Washington. Physically, once they saw me, it was much easier to talk about it, but it's still something that I try to protect them from.
100% legit. So my husband just died in May, and when he was diagnosed with stage 4 pleural mesothelioma. And so we knew that he didn't have a lot of time. There was no surgery option, only chemo. And he was very social, and it was very important for him to have people know what was going on. So what I ended up doing is I had a little notepad on my phone, and as we were going through doctor's appointments or whatever was going on, I would make notes in my notepad, and then I would edit that down to a digestible message, and I had groups in my texts. And I would send a message to my family, who I was fine if everybody replied to all and heard the communication. And I had a group of his friends, and I had a group of his cousins. And so I had these and a group of neighbors. And so I had some specific groups, and I would send pretty much that same text out to everybody, so everybody had the same information. And he so appreciated that and would say it over and over again. Jill did such a great job keeping everybody up to date. She absorbed all this information. He really appreciated that. But regarding the education issue, I did find early on I was forced to do education with our contacts, because the messages were all, oh, it's amazing what they can do with cancer these days. He's going to be fine. And I live in a very religious community, and I have faith myself, but they were talking about miracles that could happen. And so I had to set it straight fairly early in the conversation that the prognosis was not good, that mesothelioma, he would die of mesothelioma. We just did not know the time frame. And so I would continue to get those positive messages, and I would continue to say, just be prepared. And when it happened very, very quickly when he passed away. So I think because of my messaging, more people were a little bit more prepared, though still shocked.
That's what I was saying, education. Educate the people that we have in our life so they understand what we're going through. Because it's hard. The scan anxiety.
That's a good word.
Because it's like every time I do a scan, it's like, well, what is it? Is it all right? So that's why I was saying, educate people first, then take the ones who are closer to you, and then be more personal with them. Yeah. Thank you.
So it sounds like it depends upon the relationships you have with people, whether you choose to share or not share.
Hi. I just wonder what you do when friends and family call you, burst into tears, and then you have to end up taking care of them instead of them trying to support you and help you deal with what you're dealing with. You have to end up consoling them. And that I find that very difficult.
Yeah, I agree with that, and I struggled a lot with that early on. Actually, there's a good friend of ours who used to come over and pray for me every Monday, and every time she would get over there and just burst into tears the whole time, and she was always apologizing. But I think after a while, I just got okay with it. Like, I'll let them cry. Like, if they want to cry, they can cry. That doesn't have to drain me emotionally necessarily, and just knowing that they're doing it from a place of love and concern, But I would say early on it was a bit frustrating because I didn't like this sappy kind of teary-eyed, expressions of how. But then after a while, it's like, you know what? They care about me. They love me. I'm just going to let them process how they need to process and be okay with that.
Shane has a much better answer than I have, which is you just learn the people that aren't you can't expect good help from, and you try to lean on the people who are offering you good support rather than the kind of support that ends up draining you. There's a child of the 70s. There used to be there was an album called Free to Be You and Me, and one of the songs was about helping, and it was like, some kind of help is the kind of help that helping's all about, and some kind of help is the kind of help we all can do without. And that's
You should bring that back. That was a good album.
Was a good album.
Does anybody have anything else they want to share, or we can wrap it up?
Can I?
Wait,
well,
Heather?
I'll defer to questions from the audience.
Heather, did you want to say something, Heather?
Some people that I have talked to have found it advantageous to have like a content manager, so to speak. They have a very trusted person that posts the Caring Bridge, posts the GoFundMes, posts the updates, and all communication goes through that individual, which takes the oneness off of the caregiver and off of the people going through the stuff. So that is something to maybe think about if you have a loved one who wants to be useful and is good at posting and managing all of that sort of stuff. So I've talked to a number of people who do have a content or social media manager of sorts, and it helps a lot with that. And then the other thing about managing others' emotions, I just flat out told them it is not my job to manage your emotions. And, it was kind of harsh, but they kind of like, oh my gosh, you're right. And sometimes you have to be blunt. It's coming from a place of love, so we have to give grace as well. But just, sometimes people need to hear it's not my job.
This is a really interesting table. We're going to have people come and talk to you both.
So I was wondering if you could, I would like to share too, what if other people could share things that they found especially helpful. One is, I have friends, I ask them that whenever they're going to the grocery store to shoot me a text to ask me if I need anything, just because it's really hard just to go and get one thing, and they have felt really good about that. I have another friend who sends Bob a card. She lives out of state every week just to get well card or a hug. And then the support group that I do at home, they recommended this book called There's No Card for This. I don't know if you've heard of it. It's kind of tongue-in-cheek, but it's written by people who have had a lot of trauma, and it goes through each chapter about the different kind of support that you should be giving people that need it, and it's really well written and very informative.
Good resources.
I just want to echo what Heather said. My wife, when she was sick, she had a friend who would send out texts and or emails with all the information, because everyone was wanting to know, especially after you went to the doctor, and it was just too much for Chris to have to respond. So there was a point person who she spoke to, or I spoke to, who did send out information, which was really helpful. The other thing, and my wife she did not hesitate to ask for help or make her needs known, but she created a buddy system. So every week she had a different friend that she was close to who would check in with her on a daily basis. Chris didn't have to respond necessarily if she didn't want to, but there was just someone sort of checking in to see, hey, I'm here. Do you want to talk? Some friends would send funny jokes to her. Each person sort of had so every week there was a different person, and she kind of had a schedule. I did the same thing for myself, which I was a little more hesitant to do, but it was actually very helpful. And I actually continued it after Chris passed away, because usually the people are around that first few weeks, that first month, people are around, they know you, but I kind of kept it for I don't know, 3 or 4 months after Chris passed, and I had a friend that would just check in with me every day, and then a different friend would come the next week, and that was very helpful for us. So just wanted to share that.
Yeah, everybody's got a different story, but our kids were older, so they were old enough to be told. But we had lost a son earlier, so we have learned that there are caring people that will reach out, and we made a decision to be upfront. We were not going to hide in society. We were going to face this head on. And so the biggest thing I would say just hearing some of these stories is it was a one-way communication. I promise we have large families. It's a small town. We know a lot of people, lots of support. But I was not going to repeat this story over and over and over again. And so I said, please don't contact me. But I made a promise that I would keep them updated in detail when anything new came about. So we didn't hide anything. We educated them, as a good term. We shared honest emotion and feelings. But for the most part, people respected that and they kept their distance. And I realize everybody's different, but that seemed to work well for us.
Is there somebody else?
I got a hand down here, yeah.
Back corner.
My name's Lynn. So my dad was diagnosed in February this year, so I just went through it not too long ago. My dad and my mom, they basically talk to me every day, if they can. So they just told me they went to the hospital because my dad was coughing, and they didn't really get in touch with me for almost a month. And we were messaging, of course, but she's not calling or FaceTime. So by the time they tell me, I feel like they went through the emotion phase already by themselves. So it was definitely a shock for me. But I wish they would tell me earlier so that we can discuss. We can go through it together. So that's one take from a child perspective, who to whoever got diagnosed, and even for a caregiver, there is a period of time that you need to digest your own emotions. I think what I did wrong is I told some of my close friends what happened. And they just went really bluntly with caring. With caring about me. They're just telling me their experience of losing their parent. So that made me even more devastated. Yes, I wish I didn't do that. And they're another friend told me yeah, just a parent for my kid's family just got diagnosed with tumor in her brain and was passing out their day. It was I don't want to hear about those stories. Give me some time to digest my own emotion. After maybe a few months, we accept it and move on with it. I can talk more. Yeah, I think that's something especially you have friends that's really direct with you, when they're talking about how they're feeling. I know they meant for good, but really, it was giving me a hard time. It's I'm only a caregiver, and even for the patient, I think they even need more mental support.
I think sometimes it's not easy to know what you need, and then suddenly when something happens, you'll suddenly know what you don't need.
Yes.
And I think it's important when you have those moments to be able to sort of speak it. Say, this is not helpful for me at this moment. Anybody else?
I actually have a question. I have a question for people. I was curious. I didn't hear anyone speak about the experience of being talking to as a adult child, talking to your parents or to your siblings about your diagnosis. And I wondered if anyone here had that experience or wanted to speak about that experience.
Our youngest child, she's a nurse practitioner, so she's very medical and all this type of thing. But she came over to the house one day and brought a book. And this book was for me to detail my life. She wanted me to start with my earliest memory and every major, minor thing in life. I've been filling it out for months and months. And she says, this is what I want. I want to know, what wisdom can you give me? What mistakes did you make? How do I not make those mistakes? You know, all the things that I would want to ask you. And I'm hoping you're going to be here, but in case you're not, this little book will help me. And I thought, you know, she can pass it around to her siblings. She could pass it around to her children. And that was really intuitive of her. Very. Yeah.
What a nice legacy to leave her.
So you'd have to run all the way across.
She's getting her steps in.
My name's John Anderson. My wife passed away a year and a half ago. Going through the things in the house and cleaning house, I found some diaries. Some were for her granddaughter to read, and they were about stories when granddaughter visited the house and little quotes of arguments if she didn't like something I did or this, and she explained things to her in the book. I haven't given her that book yet, but I also found another book that she kept as she was growing up, the grandchild, and she kept little meticulous notes and things into it. Several months ago, I gave her that book to read when she had time. I said, find a place, read it. The other book, I don't know yet. And then also, I found one that I gave to my daughter, who is on the board, and probably at a meeting, of personal notes that she had left behind. I keep finding these things in corners, and I haven't cleaned the house out yet. And I just gave that to my daughter recently, and I read through the notes, and my daughter got a little with me for a minute because it said personal. I says, well, my wife was personal to me. So what she knows, I know, and if there's any secrets, I'm going to find them. And they were very good. I didn't read all the notes. I can only read so far, and I broke down, I covered it up, gave it to the daughter. But it's a good thing to pass on, future generations to understand it, family to understand it, and so let it go from there.
Yeah. Julie,
we have one more back here.
The one thing I got from my adult children was their frustration of people coming up. They wanted anonymity. They wanted to kind of process this in private, and having all of these people coming up and like, hey, what's going on with your dad? Hey, what's going on with your dad? Hey, what's going on with your dad? And their anger was, if we were small children, people would leave us alone. Like, they would respect our boundary. They would give us peace, and they would show us grace if we were small. And they would let our parents protect us. But because we're adults, they feel like they're entitled to kind of violate us and bombard us with all of these questions. And these are questions that it's like, ask my mom, ask my dad, stop coming to me. Especially with my daughter, because we both work in mental health. And she works at the clinic that I had just left, and everybody there, instead of coming to me, was bombarding her, like, what's going on with your mom? And so they were just very, very angry. And so I think that they just kind of isolated themselves and only had each other to talk to and to depend on, and to the point where they wouldn't even talk to us. And it was very heartbreaking for me to watch my adult children kind of go through this, because it almost was like we have no one, because everybody was afraid to come to us. So they became these people was like, they were the information, like, oh, well, let's go to the kids, because we don't want to bother him and we don't want to bother her, so we'll just ask the kids. And they're so crushed because they're dealing and trying to cope with this idea of, my dad is going to die and we're in our 20s, we're babies, and you know, my dad's supposed to be here when I'm older, and he's supposed to be here when we get married, and he's supposed to be here when we have kids, and we're not supposed to watch our mom go through this. So they didn't have this space to grieve. So I think that people don't recognize, like, just because they're adults, they also deserve this peace. Like, let's treat them like they were small children and give them that space and give them that grace. And so I think we're not mindful of what children are going through because they're adults. And so we're super mindful of little kids, and we just completely dismiss these adult children. And it's just as heartbreaking and just as hurtful, and just like, they're still children and they're losing their parents. And like, we really need to show them grace and really kind of be there to embrace them just as much, because it really is, it doesn't matter if they're 25, 30, 40, like, let's look at them as this little kid because they're mom and dad or whoever. So my kids are just very angry at the way kind of everybody else is treating them, and not getting that space that they want and feel that they deserve, because people are like, well, you're an adult, you should be able to cope.
That's such an important point. Thank you. I think we're about to run out of time. And Claudine, did you want to say something before? Or am I imagining that?
Yeah, I did have my hand up. And I don't know, maybe it works pretty well as just kind of a closing thought. I don't know if you have anything. But I guess one of the things I wanted to make sure to share today is that living through a serious disease like mesothelioma can bring your family really close together. It can eliminate some of the petty things that might have bothered you before. And there are times when that can feel awful. It can feel awful that you're like, oh, we're so close because of this cancer, because you wish the cancer didn't exist. So I guess I just wanted to acknowledge that that's a thing that families go through. And it just can be just a really confusing mix of emotions. But ultimately, it's a welcome thing to know that you all have each other's backs, and that you've been through this horrible thing together. So I just wanted to give voice to that.
Thank you. Shane, do you have anything you want to wrap up with?
No, other than just saying thank you,
Thank you.
to you guys. I mean, this is our first one of these to come to, and you guys have been so welcoming, and you guys have been so helpful over the last year, and so we're just grateful just for the interactions and just friendships that we've made in this community. Thank you.
Thank you, everybody.
Thank you to our panel. Thank you to Beth, Claudine, and Shane, as well as anyone else who shared during that panel. We're going to take a really quick break. There are what smells like really good cookies in the lunchroom, and as well as drinks. So we're going to break, and we'll be back in here at 3:15 for our next panel. So feel free to go ahead and get some refreshments.
Hi, my name's Joe Bellick, and I'm the founding partner of the law offices of Bellick and Fox. We support the mesothelioma community by providing first quality legal representation to mesothelioma patients and their families. We're proud to support the Mesothelioma Applied Research Foundation so they can continue the work that they do every day on behalf of mesothelioma patients and their families.
Hi, I'm Trey Branham. Dean Omar Branham and Shirley is proud to sponsor this year's Mesothelioma Applied Research Foundation Conference. The 34 lawyers at Dobbs have more than 400 collective years providing legal representation to victims of this insidious cancer. We applaud the leadership of MARF and this community for its tireless dedication to finding a cure for this totally preventable disease.
At MRHFM, we exclusively help mesothelioma patients and their families. It's all we do.
This is why we are proud to sponsor the Mesothelioma Applied Research Foundation and its work to fund mesothelioma research and provide support services and education for patients and their families.
Welcome back, everyone. We're going to go right along into our next panel. And this panel will be an interesting one because it is about the changing demographic of mesothelioma and mainly about the different issues that young patients face. I know a lot of us working at the foundation, we hear a lot about whenever you say mesothelioma, people are like, what's that? And then there's a lot of assumptions about it. And one of the things that I always say to people is you don't even know how many young people experience this. And so this panel will be filled with individuals who were diagnosed at a much younger age, and they'll be able to discuss the issues that they've come across. So please welcome Jessica Blackford-Cleeton, Locke Tall, and our moderator, Heather Von St. James. Thank you.
Thank you. I don't have my high shoes on today, so I feel short. Thank you all for being here for this panel on young patients. I am not so young anymore, but I was when I was diagnosed. I was just 36 years old. I was a new mom with a 3-month-old baby and told I had 15 months to live. I looked at the doctor and said, no, I have to raise my child. What can you do for me? And thankfully, I was given the name of a specialist in Boston, and I had to travel across the country to see this specialist. And I had surgery, and it was successful. But I also missed the entire 6 months of my child's life. He was living with my parents at the time. They thankfully were able to take care of him while I was in Boston having surgery and fighting for my life. That child is now 19, and he's fantastic. So I'm glad to still be here. But at that time, being 36 years old, I was one of the youngest patients to be diagnosed with mesothelioma all those years ago. And in the last 19 years in doing advocacy, I've met so many more. And right here with me, I've got two, Locke and Jessica. So we're going to talk about a few different challenges that have faced young patients today. And the first one would be fertility and family planning, because that is really heavy on a lot of young patients and AYA patients. What do I do about kids, especially if you're diagnosed in your 20s? Like, can I have kids? Is that even a viable thing? I was told after my surgery to never get pregnant again, that if I did, it would probably endanger my life. So I'm thankful I have my one son. But I was never able to go into any fertility or preserve my eggs or anything. It was off the table. So I know these guys have some great input. So Jessica, I'll let you start.
Hello, my name is Jessica Blackford-Cleeton. I was diagnosed with peritoneal mesothelioma when I was 32. I am 42 now, so it's been almost 10 years. And something that, Heather pointed out that I had struggled with was at that time was fertility. So I was newly married just for a few years. We were trying to have a baby, couldn't figure out why it wasn't working. Well, I had a bunch of cancer, and that's why. I was able to have HIPIC chemotherapy. About a year after that, decided that we would try for babies. Now, I will say when I was first diagnosed, I really kind of had to fight for that right to have my fertility preserved. The doctors are amazing, and my surgeon was amazing, my oncologist is amazing, but they are amazing at curing me, not what I would need in the future as far as fertility is concerned. So my surgeon was great. He's like, listen, if you want to do this, take a few months, see a fertility specialist, see if you can conserve some of your eggs, so you might have a chance afterwards. Well, I had too much involvement for them to be able to do that. So I basically begged my surgeon and said, if you can keep an ovary, if I have any chance. Now, if I'm going to die anyway, just take it. But if there's any chance at all, try to keep that intact. So he was great, was able to keep one. About a year after that surgery, everything was well enough that my husband and I made the decision to go forward with IVF and had our first son, Avery, 7 years ago. And then Elliot is now 5. So we've had 2 sons since, been very lucky. That is not an easy decision to make when you're someone in my position, not as a patient or as, a caregiver. something that I talk about a lot, because even though there aren't a lot of younger patients, when there are, fertility is the last thing that they're thinking about. So it's always been very important to me that other patients know that you do have options, even when you're first diagnosed and people aren't really talking about it.
I have nothing to add there. So
Just wanted to give him the opportunity. So, and with a bunch of with younger patients, we do have younger kids at home usually, and I know that is the case with Locke. You have younger kids at home, don't you? So my baby was raised with me. It was part of the conversation forever. Mesothelioma has been part of his life since 3 months old. He doesn't know any different. So that is the conversation in our house. But Locke, maybe you can share with us how you deal with it with your kids.
it's nice to meet you. Also, I want to give some context in terms of what I'm going to share, because it's not just the people in this room. Going to the conference is my second year. There's a certain amount of survivorship bias, because these are the people that can afford to and also well enough to be at the conference. I know a lot of people are online at home. So I want to share with that, because I have friends that wanted to be here, but they couldn't due to chemo schedules or whatever it may be. Regarding when I was diagnosed, I was 49, which is crazy to think that that's young for this disease, kind of a thing, because I feel old as hell. And then, I'm almost 52 now, so it's been about 3 years. And but at the time, we have 4 kids, 2 boys, 2 girls. I had a 7-year-old when I was diagnosed, 12-year-old, who was doing the 12-year-old thing, which is really complicated, as far as the teenagers and stuff like that, a 15-year-old, and then an 18-year-old in college. So now they're both in college in terms of that. There was a lot of talk earlier about families and kind of like gatekeeping and when to share. Part of it is our parenting philosophy is just age-appropriate experiences for them. And so, because obviously for a 7-year-old, her ability to process what dad is going through and mom is going through is very different versus my 18-year-old. And so we tried to we were very open about it. Do you know what I mean? We didn't try to, you can't really hide it because you're going through chemo and stuff like that. And so, but obviously I didn't have like this deep talk with my 7-year-old and, say that dad's probably going to kick the bucket kind of a thing. Do you know what I mean? And so, but for my 15 to 18-year-old, they understood. And I'm not going to, they're extremely savvy. So there isn't like, oh, don't go Google stuff, right? And so it's impacted their lives, I think, in some ways positive. It made my son extremely motivated because he felt like he had to be the primary, caretaker for the home kind of a thing, right? And it's great. Like he got into an Ivy League. I'm like, good for you. Keep going. I don't tell him I'm not going to die kind of a thing because apparently it's working well for him. And so I'm like, go for it, dude. You know what I mean? So, I was like, do your investment banking, whatever the hell you want to do. So, yeah. But I think, but it's different for every kid.
Parenting 101.
Yeah, sorry. But for my 12-year-old, one of the challenges was that he was emotionally, probably one of our most challenging kids, going through it. And so my wife was just like, I don't want you to die because I can't deal with this kid by myself. Do you know what I mean? And part of it was like, I had to live just for that. So there are markers that you give yourself. And I think from my experience, there's what we call one-way door and two-way doors. Cancer and meso is a one-way door. Once you go through, there's no going back. But I think in terms of thinking through the disease in terms of 3-month increments and sprints, and there's a lot of two-way door things that you could kind of do and kind of come back from, if that makes sense, you know what I mean, and try. And so you have to kind of figure that out and then also figure out, I think someone shared about in that journey, there's different points and things change. And the way I talk to them about it now versus like then, especially when I thought I was given only 12 to 18 months, because that's what they all tell you kind of a thing, you know what I mean? And so it was just very different versus preparing for death and for the kids, especially I was the primary caregiver. That's a whole nother thing, is the whole money situation. Do you know what I mean? And so, yeah.
Just to piggyback off of that, my sons grew up with it, obviously. So they used to go to appointments with me pre-COVID. they knew all the doctors, and they know mommy goes to appointments. They know mommy sees doctors. They know mommy is sick. I've said mesothelioma to them many times, and then 2 minutes later they'll forget. So they're just kind of at that age where they're not going to really remember. So you can't get much into it, but they know, and they've grown with it, and so they see it. And we've never really kept anything. Any questions that they have, they know they can ask.
Thank you. So another thing that we deal with, anybody who's under 65, usually even older, the work-life balance. I was in the prime of my career when I was diagnosed. I was part owner in a $3.5 million salon company. I know that's really hard to believe. I worked in a salon. And I had a thriving clientele, and that all went away immediately because there was no way I could work and continue to try and help people with one lung. So I ended up quitting my job, selling my salon, and going on disability, and that was really difficult. Somebody in the patient group had said losing the career was almost worse than getting the cancer, and that's what I dealt with. And so thankfully I've been able to pioneer my own path since then. But other people, I know, Locke, you work full time, and I know plenty of other young patients don't have the ability to quit their job like I did. So I'd like to hear your guys' experience with that.
Yeah, I have to agree with that. I think before I was diagnosed, I worked really hard at my career, traveled a lot with work. I was an executive there in state government, and you identify a lot with what you do, and you put a lot towards it. And after I was diagnosed, and for the year before I was diagnosed, working was very hard. I was using up all my sick time, not knowing why, and I had to eventually quit, and that was very hard, especially when you identify as that. And I still say it's very hard when people say, so what do you do? Yeah. And it's like, I'm just going to start saying I'm in the mob, because then maybe it'll just shut it down. But then you have to get into explaining, well, I don't work and here's why, and then you get the sympathy, and then it's just like, no, it's okay. And it's a really hard conversation to have, especially with people you're just meeting. But yeah, the identity there is a big thing, and something that people don't really talk about, especially when you're that's what you do. You want to get ahead, and you want to get to a certain place, and have worked basically your whole life from college up to get somewhere, only to have it taken from you.
There's no right answer, I think, to this, so I can only share from my own experience. And that's another thing that's really weird about the disease. It's an orphan cancer, and so there's not a lot of people that have it, and then the information is all over the place. You know what I mean? And so everyone says they're a specialist, even if they're not. Yeah. And then you're searching websites and stuff that you probably shouldn't. And so in terms of work, it was complicated. I'll just tell you from my perspective. I had 4 kids. I'm the primary wage earner or whatever. My wife is way more accomplished than me, smarter, all of that. But she chose to be a homemaker or whatever you want to call it. So it was I couldn't quit if I wanted to. And I actually worked all the way through chemo, right? So I did 11 rounds. And I was lucky in that the kind of job I had in sales, they don't really check on you. They just want to know that you're selling. You know what I mean? And so I could be playing video games all day for all they care, as long as I hit my numbers. And so, but I did have to eventually take a lesser role in the company. Luckily, I was kind of like a made man already inside the company, so I could do whatever I wanted. But I took an easier role. I call it fake sales. And so I'm just an IC now, and I'm kind of chilling, doing my thing. And so, but yeah, I mean, sometimes I'm like, damn, I wish I could retire. So I think about it all the time. I hate to be that guy, but I'm like, yeah, man, I'm thinking about retirement all the time. So yeah.
If you haven't noticed, we all have a really kind of twisted sense of humor.
Yeah.
And we laugh and we joke a lot about this stuff, because if we don't, we will go crazy. So yeah, we look at things through a very skewed eyesight on some things, but we're here and keep sharing because of it. So, I don't know what that is. Anyways, So what a lot of people don't tell you when you're young is you need a will, you need a healthcare directive. I was writing a will at 36 years old, and that to me just seemed so just unreal, and it was very strange for me to go through that. But I have it. Oh, it's a I keep. There we go. So, those aren't things that you're prepared as a young parent or a young adult to have to deal with. So I kind of avoided it as long as I could until I went to Boston. Then I was like, I have to write a will, just in case something happened. Because I was filing a lawsuit, and I wanted to make sure that any proceeds from a lawsuit would go to my family. So, and that brings up another interesting aspect of being a young patient is, the will, the healthcare directive, and then the lawsuit implications due to our young age. We don't talk a lot about exposures, but it's very hard to determine when you're under 50. So, they work really hard to make sure that they represent us well. But, it's like the wills, the healthcare directives. How did you guys handle all that?
I think at first I was just kind of stuck in auto mode. It was like everything being thrown at you, and you need to do this, and you need to do this, and it was just another step. I think the first thing that really came were the medical directives, like the DNRs, and I don't even remember. I do remember later on, I think after the birth of my first son, which is when I really sat down and did a will, which was stupid. I should have done it right after I was diagnosed, before I had the kid, now that I think about it. But it's so important. Life insurance, too. It's something that we don't think about until we need to. And unfortunately, after you're diagnosed with something, trying to get life insurance is so hard. So I always tell people, get life insurance when you can, when it's cheap. Because you have to think about, after you're gone, the people that you're leaving behind. And something else you need to think about is how that money is going to be dispersed. And if you don't have anything in place, the government can disperse it in ways that it wants to, and you don't have that decision, and where your kids go, and there's just so much to think about. So my thing is just always get a good lawyer, someone that really works on this and knows what they're doing. Talk to family members that have been through it, friends and family members that can recommend people. But it's very important to have in place. And I know it's just one of the last things that you want to think about, because what you're thinking about is your health and getting better, or just anything else besides that. But it's something that needs to be done.
This is a really hard topic to talk about, because when you're sick and you're younger, even when you're older, you're dealing with, think of it like spinning 12 plates, and then you get the cancer, and then like 8 of those plates are cancer. Do you know what I mean? There's a lot of things that get dropped, and you have to kind of think through things. And so I was juggling a full-time job, chemo, a lawsuit, and then you're dealing with insurance, right? So, because insurance doesn't want to pay out. And even if they're supposed to pay out, I mean, they're sending like nasty grams and sending us to collections, even though we never even got the bill, kind of a thing. Do you know what I mean? And so you're dealing with all 4 of those, and it's a lot. So I would also recommend that not just a will, but you really have to do a trust. And so, and then from the settlement, as far as a lawsuit, we actually had to create trusts with guardian ad litem for the younger kids. And so, and then you have to kind of think through, prenups for them and other things like that. So these are all discussions. My own scenario, I have a genetic situation with BAP. And so that means that my kids are 50-50. And that all BAP is that it's kind of like, what's the one with, the breast cancer one, BRCA, right? Where you have a greater propensity toward, mesothelioma if you're exposed to asbestos. So we haven't had that conversation with our kids. I could say this online because I know they're never going to find this damn thing, right? And so, what do you call it? Nah, dude, they're not that savvy. No, they're too into themselves. So, but no, I think.
Famous last words.
Yeah, I know, right? No, but what was I talking about? Yeah, they excuse me. Sorry. Oh no, not at all. So, but I think you got to think through those things with them. So there's that piece of it. But I definitely do a trust, not just a will kind of a thing, see if they deal with the assets. So, and then estate planning if you have that issue.
So another thing that we deal with is, what if you're single? What if you're young and you get diagnosed and you're single? Do you tell your potential partners that you're going through this? Do you even have energy to date? There's so many weird things that happen. I was married for 7 years, so that was different. But a lot of marriages don't last a diagnosis, especially in the AYA community. They don't last. Divorce is extremely high in younger diagnosis. I'm happy to say my husband is fantastic and glad he's still with me. I'm hard to live with. I don't know how he stays, but relationships, not just dating and marriage relationships, but friendships too. People you think are your friends don't stay around, and I witnessed that a lot. I was part owner in the salon company, and everybody I worked with were my greatest friends until I got sick. I never heard from them. They accused me of faking it because I didn't lose my hair during chemo. So it's I literally lifted my shirt up and said, yeah, I'm faking it, and show them my big scar. And things like that really hurt, and they don't teach you how to navigate that. As a young cancer patient, nobody talks about that. So I don't know if you guys had anything with relationships, any wisdom you can share.
So I was also married, my diagnosis, but I mean, we had some deep conversations about it, and I told him, I'm like, we're barely married. We don't have any kids. This is your out. Just get out. It's gonna be really hard. And he's just like, no way. Great guy, but it's not been easy by any means. There's when your partner becomes your caregiver, there's a huge change there, and it's things that we've had to work through and continue to work through. But as friends, and I completely agree with you, Heather, there are some people that just cannot deal with it. And it's sad and it's heartbreaking that you've known people for so long that, they just don't know what to say or what to do. And then just eventually they just kind of disappear. They always say a cancer diagnosis shows you who your true friends and families are. And that's absolutely true. I still have some of the greatest friends, but I have some people I barely even talk to anymore since diagnosis. And that's just part of it. And sometimes you just have to let those people go because it's more fight that you don't need to deal with that. You don't need that drama anyway. So.
Amen to that. Bye. So, yeah, I mean, I think for us, we're also in a faith community, and we've got a lot of I like to think of relationships in terms of circles. I mean, you have your inner circle with your spouse, your family, your close friends, and then kind of the outer ring, so to speak. We did have proxies for us to kind of handle as champions, so we weren't inundated in terms of, that kind of a thing. I'll be honest, I have a lot of friends and I have a lot of relationships because I'm in sales through work, literally thousands, and it's just overwhelming. Do you know what I mean in terms of that? And so, but you're right. People you expect to be there for you, like family, are not. And then some people, truthfully, even with my own kids, some I think felt like they're closer to their mom now because they feel like she's going to be around versus I'm not, kind of a thing. And I'm inferring that somewhat, if that makes sense. Do you know what I mean? And one thing I would encourage, I think 100%, 1,000%, is you have to go through therapy. So find a good therapist. I'm a Christian. And I'm a dude, so I was like, I'm never gonna do therapy. Do you know what I'm saying? And so I was like, I don't have time for this shit. And so, pardon my French, I shouldn't say that. I'm in a conference, but you do though, because us guys, we're not super self-aware. Do you know what I mean? All the things that my wife is going through as a caregiver, dealing with the fear of being alone for a long time. It's not like we lived our whole life, and it's like, okay, there's a few years left, whatever, peace out. But you're talking decades left, right? And so, and then just all of that. So I think therapy has been incredibly helpful, giving me vocabulary to kind of process things, draw boundaries, you know what I mean? All of that. And so be a better spouse, be a better dad, be a better friend. So, and by the way, these women are incredible. Like, one of the greatest things about going through this whole stupid disease and meeting some wonderful people. And Heather, you never introduced me to your husband. So I was like, do you have a husband?
I do.
Okay, because you never introduced me to him. So anyway, but they're wonderful, and so I love. I mean, I just respect them so much.
On the down low and on, you know,
I hear you. I hear you. Because he's never here, dude. So anyway, yeah.
So years ago, I met a gentleman named Ted. The old timers here remember Ted. Ted told me, like, on the third day of the symposium, my very first one, he's like, Heather, mesothelioma is the shittiest way to meet the best people. And he was so right. And I have found this community to fill that spot from those people who left me high and dry. I've made lifelong friends. Whenever Jessica comes to the Twin Cities, we get together, we meet at the Mall of America. And, you know, I used to go to St. Louis for a race, and we would get together then. So I've been really fortunate to meet amazing people in this community that have filled those spots, and we are family here. And I'm really, I don't say excited is probably the wrong word, but I'm glad is the wrong word, trepidatiously happy to see a lot of new people here, because the community, we're only as strong as the community that we are involved with, and you guys are the future of this community. So having so many participants and having people here, and especially you watching on the live stream, we'll be here for you when you need us. And that's what I want to get out about being a young survivor, is find your group, find your community. And that's why this organization is so very important. I don't know, I guess I could, we can just end with that. We can answer any questions. If anybody has any questions for us about anything. Nope. There's lots of wisdom here. Anybody here who's dealt with this has wisdom, whether you're newly diagnosed, whether you've been around it for 2 decades like I have. And so talk with one another and get to know people. That's why we're here. So thank you for attending, and we'll see you later.
We're going, before anyone leaves the room, we're going to have another panel at 4 o'clock. And for anyone in the bereaved community, we're going to have a celebration of life ceremony. And Beth, if you want to stay right there and wave, it's going to be in another room. And Beth is going to lead the way to where that's going to be. So bear with us, and we'll get our next panel and our last panel of the day in just a moment started.
So if you're heading to the celebration of life, you can go ahead and head down the hallway. It's about to start in a few minutes. Julie's waving over here. If you see her, she's going to head in that direction so she can point you in the right direction. If you head down there, it's room 3. That will be getting started in a few minutes. And then we will have a concurrent session in here. So in this room, we're going to continue on with the panels. And the next panel is our survivorship panel. So we're going to hear from a few long-term patients. So I would like to invite up Heather Vaughn St. James again, as well as our moderator, Rich Mosca, and then Bill Ziegler will be joining us as well. We're going to wait for everyone to kind of get out, but then you all can go right back.
Hi, my name's Joe Bellick, and I'm the founding partner of the law offices of Bellick and Fox. We support the mesothelioma community by providing first quality legal representation to mesothelioma patients and their families. We're proud to support the Mesothelioma Applied Research Foundation so they can continue the work that they do every day on behalf of mesothelioma patients and their families.
Hi, I'm Trey Branham. Dean Omar Branham and Shirley is proud to sponsor this year's Mesothelioma Applied Research Foundation Conference. The 34 lawyers at Dobbs have more than 400 collective years providing legal representation to victims of this insidious cancer. We applaud the leadership of MARF and this community for its tireless dedication to finding a cure for this.
Okay, everyone, we are at the last session of our day now. And like I said earlier, this is our survivorship panel, where we have a few long-term patients up. So please welcome our moderator, Rich Mosca, as well as Bill Ziegler and Heather Vaughn St. James.
Thank you. Thank you, everyone. Besides Locke and Jessica, is everybody here a first-timer? Did I miss anybody that's been here? Everybody's a first-timer that's raising their hand? Okay. So I was very impressed this morning when we did the patient group, that everybody was so well informed, so on top of everything, and we spoke about so many things that I had to go back and redo my notes because I had all these topics to go through, and we spoke about them, but that doesn't take them off the table here. If we want to talk about something that we spoke about this morning, let's do it. I have a couple that I'd like to bring up. I want to make a couple of points about the foundation. I've been part of this foundation for over 16 years, and I want to tell you, I'm going to echo what Heather spoke about previously. Make friends. Stay with them. Don't be afraid to tap on anybody's shoulder while you're here. That includes the doctors and the researchers. If they tell you they don't have enough time for you, then they shouldn't be here in the first place. They're here to speak to us, to give us the hope that we need and the information that you need. If you have a question about anything, ask. Don't be afraid to ask. They're human beings just like us. They just speak a different language every once in a while, but they're fine with us. Just a couple of rules. Anybody that knows Heather and Bill and I, we could take up to 45 minutes in this session without even starting to ask questions. So I'm gonna just limit us to like a minute, 2 minutes each to give you our story, and then we're gonna talk about whatever we want to talk about. I'm gonna start with Bill first.
Can everybody hear me?
Name, rank, and serial number.
Sounds good.
Okay.
My name is Bill Ziegler. I'm from Rochester Hills, Michigan. I was diagnosed in 2011 with pleural mesothelioma. At that time, my options were very much limited in the local market, so I decided to go out east, get an expert opinion, and it was told to me that I needed to have surgery at the time. That was a time when surgery was very, very popular a treatment. However, they wanted to know whether or not I was a first-line responder to chemotherapy, so I immediately went back to Michigan, started chemotherapy on a 3-week regimen for I think either 3 or 4 cycles, and unfortunately I was not a responder. So after which I went out to Boston, had Dr. David Sugarbaker perform my surgery at the time. I received a right-sided pleurectomy along with heated chemo. I came back to Michigan, recovered a little bit, was going to go back on chemotherapy, but I really didn't respond the first time too well to it. It seemed as though my disease had kept growing. So at the time, my local oncologist decided that it would be best for me to do some radiation. So at that time, I did mediastinal radiation, and I was pretty much good to go, but because of the foundation and the knowledge that they had, there was another trial that was in New York. It was the WT1 peptide vaccine trial at the time. So I went back out to New York on a blinded study, did that for about 3 months, came back, and I have not had a cancer-related treatment since then. So that was, I think, August 2012. That's a little bit about
13, 14 years.
13 years.
Okay.
Yes.
I'm going to go second because we're ramping up. Okay. Rich Mosca, I was diagnosed in October of 2006 with peritoneal mesothelioma by accident. I just went to my doctor for my annual physical, and he was smart enough at the end of the physical to say, is there anything else you want to talk about? And I said, I feel something here. I'm not sure what it is. It could be the diverticulitis kicking up. He sent me for a CAT scan. They saw the fluid. It took 3 months to diagnose me. Then I had 3 surgeries, the first HIPEC, and then 3 regimens of doxorubicin, cisplatin, and at the time they were using interferon B. And I had the only surgeon that actually did a second look surgery after the 3 sets of chemo. and they opened me up and they found one dot, and they took that dot out and closed me up and said, good to go. I had what they thought was recurrence about 3 years later. It was an infection, but the good part about being opened up again is they saw nothing. So that was my rationalization for having the third surgery. So it'll be 18 years this December. So, Heather?
So I guess I'm the old timer here. I was diagnosed in November of 2005. So I will be 19 years out on November 21st, 2005 this year. I had just had a baby and I never recovered from my C-section. I got sicker and sicker and they thought I had pneumonia, only to find out I had 1.5 liters of fluid around my lung. They drained that, sent me for a CT scan, and found the mass on the lower left portion of my lung. And I shared before they gave me 15 months to live. I said no. They sent me to Boston. I saw the Dr. David Sugarbaker as well. And he removed my entire left lung, the left half of my diaphragm, the lining of my heart, the 6th rib, and also did heated chemo during surgery. So it worked. I came home. I followed that up with 4 sessions of Alimta and cisplatin, or carboplatin, one of the platins, and then 30 sessions of radiation. Radiation is the gift that keeps on giving, and I have lost my voice due to it, and I have a host of issues from it, but I am alive, and I am here. So, 19 years, November 21st.
Pretty good, huh? Is that survivorship? So there was supposed to be a third panelist here, Sue Ellen Crano, and Sue Ellen is about 21 years out. Yeah, she was the longer term, and Julie Gunlack, who was 3 months in front of me, she had a choice of coming here or going to Paris on vacation. So I think she took Paris. But again, Julie we were treated at with the same doctors, and she was I latched onto her for my survivorship because how well she did, and we stayed in touch with each other over all these years. So that's why I'm saying make friends, stay in touch, don't go away from here, and go through this by yourselves. It's a small community, and as you can see, we know each other for years. So it's one of those things that you just need to do, just to help that survivability. So after the morning session, I looked at the sheet here and I said, what does survivability mean? Survivability. And I looked, the first one was it's a state or condition of being a survivor. Okay, I know that. And then I found the medical term of it. It says it's a focus on the health and well-being of a person with cancer from the time of their diagnosis. So it's a long-term thing for us. So it's something that we need to accept and just keep working at every day. I have a bunch of topics. We don't necessarily have to stay with the topics. If somebody wants to bring something up that was triggered from this morning's session, or they want to bring up what we spoke about this morning again, that's fine. This is your session, not mine. We don't have any slides. Speak to us. So the topics that the foundation and we worked on were ongoing treatments, long-term implications. I have a statistics one that I'm going to speak about shortly and get that out of the way because it's a little complicated and I just want to scratch the surface on that. Ongoing mental health, we spoke about that too. Survivor guilt, that's one of my favorite ones. I'll tell you why. And advocating and staying involved and not pulling away from the foundation. We're not here to make money, we're here to help people. You know? So this morning, Bob made a comment, and I had the pleasure of sitting next to Tanya, and Tanya was talking a lot under her breath while we were talking, and I heard her say a few things, and she essentially said, I don't care about these statistics, I'm staying. Nothing's going to happen to me. And I think, Bob, you said, to hell with those statistics, this is where I'm going. Am I correct in saying? So how many people, show of hands, when you were first diagnosed, the first thing you ask your doctor or eventually say, well, what are the numbers? Where am I going here? I mean, so a lot of people have done that. I did the same thing. And I got the 1/3, 1/3, 1/3 scenario. And I just said, no, that doesn't fly. I said, well, I was telling Tanya a story. Early on in this, in the foundation 15 to 16 years ago, one of the things that they did that evolved into the bereavement group that we have now, that's going on now, is we had a wall of people that had passed away. And it got bigger and bigger every year. And it was our first symposium, and I think it was in Washington. And they gave everybody the opportunity to stand up and say something. And I was terrified. I said, I can't. There's like 150 people in this room, and I was terrified. And I looked up at that wall, and all I said was, I'm not going on that wall. And this is what Tanya said, and this is what Bob said. I'm not going on that wall. We've taken that wall down for a lot of reasons. It's evolved into the bereavement group, and I'm not going in that room either. So I wish Sue Ellen was here, because she's read this article over and over again. But I shared this with somebody before. It's an article by Stephen Jay Gould, and the title is "The Median Isn't the Message." And I'm sure the foundation will get it to you, but it's an old article. It's about 15 or 20 years old. But he was a statistician, and he was diagnosed with peritoneal mesothelioma, and at that time there wasn't much to go on. And his doctor said, don't read up on this stuff, don't read up on this stuff. And he was a statistician, and of course he read up on, and the whole article was about the median, the mean. This is a personal story for me, but there was one section in there that I'll read to you that made a lot of sense. The one thing that everybody knows is mesothelioma is incurable with a median mortality of only 8 months. Sorry. And he basically said attitude is clear matters in fighting this disease. So at the end, he made a really good comment here. He says, knowledge is indeed power. And he says, the problem may be briefly stated. What does median mortality of 8 months signify in our vernacular? As I suspect that most people, without training in statistics, would read such a statement and say, I will probably be gone in 8 months. The very conclusion that must be avoided, because this formulation is false and because attitude matters very much. And John's not here, and I'll just make a reference. See Bonnie Anderson, because if you knew Bonnie Anderson, you know exactly what I'm saying. Bonnie Anderson had started out with mesothelioma. She had leukemia. She had kidney disease. She had lung cancer. Breast cancer too. Forgot about that one. And she is the epitome of what this article is. So I just encourage you to read it. It's a little technical at times, but it really, really gets to the heart of the matter. And Stephen Gould passed away, but not from mesothelioma, like 20 years later. And the last thing he did was he was talking at the end, and he said he was a statistician, so he says, my death was announced at a meeting of my colleagues in Scotland, and I almost experienced the delicious pleasure of reading my obituary penned by one of my best friends. He said the report of my death was greatly exaggerated. So just keep that in mind. The numbers don't mean anything. This is a very individual disease, and it takes a lot, but we can beat it. We can fight it. And 18 years ago, I didn't have the options that are out there today. So that gives me more hope about where everybody's going to be. Please talk, and then please ask questions.
You know, so often we talk about attitude, and something that I like to say over and over is PMA all the way. For me, that's positive mental attitude, and sometimes it can be hard to get there. But you got to make sure that you surround yourself with the cheerleaders that are in your life that spur you on and motivate you to do what you need to do. For me, it was my family, my kids, my coworkers, and friends. And everyone brought a little bit different of a perspective to me. So often you hear the term, you know who your friends are. And for me, I was lucky enough to choose good friends that had differing opinions of where I was. Some people said, hey, you know what? You might not beat it, but we're going to make sure you have the greatest life. And then you had the other friends who say, you know what? You're going to beat it. And you can take it different ways, or you can take a look at your friends and say, you all have my best interest at heart, and your intent shows me that your friendship means not only a lot to you, but also to me. So surround yourself with good people. Make sure that you get the motivation that you need from them, and the cheerleaders are what will help you have that positive mental attitude. Your thoughts?
I might be kind of a downer here, but I say Survivorship is a shit show. I'm a little maybe jaded in my many years, and I've seen a lot, but it all boils down to I made a decision that no matter what happened, I wanted to live. And I went through a lot with the surgery, with the radiation, with the chemotherapy. I have lingering issues from those treatments, but I'm here. And my 7th year of survival, I spiraled into a very deep depression, and it manifested in me thinking my kid had cancer. I had been involved with the cancer community for 7 years, and I knew that my 2nd grader throwing up was leukemia. I knew it. It was a 2nd grader. They come home with their little petri dishes. Every 2nd grader throws up. But I knew in my heart of hearts that my kid had leukemia, and I unknowingly probably traumatized him by making him get blood tests at 7 years old to make sure he didn't have leukemia. But my husband's like, you need help. And so I'm a very positive person, very, very positive about everything, but I was also positively miserable inside because I had buried down my fears so deep. And my husband's like, you need help. And I was diagnosed with PTSD, and I got the help I needed to dig myself out of that hole and to recognize those triggers. I still had a positive mental attitude, but it also lived alongside a whole lot of fear that I never addressed. And so thankfully for that therapist, I know you had said something about a therapist too earlier, that literally saved my life and gave me a new outlook on life. And I had been doing advocacy, and that therapist said maybe advocacy isn't the best thing for you, maybe it's bringing up too much. And I wanted to challenge that and thought maybe getting out of my head and helping others is exactly what I need. And I dug in deeper, and that's why I do what I do, and that's why I'm involved with the foundation, because advocacy saved my life. Not just my treatments, but helping people and talking to people from across the globe gives me hope. And it hopefully gives other people hope that they can beat this disease too. Survivorship might be a shit show, but boy, is it fun. Because I've had a blast these last 19 years, and I don't intend on stopping. And it is an honor and a privilege to be here with you guys and starting this journey with you. And I'm glad you're here. You're in the right spot to equip yourselves to better navigate the coming months, and we're here with you the whole way.
So, talking about hope, a little personal story. So, about 5 or 6 years after, a little bit more than that, 7 or 8 years after I was diagnosed, I met somebody. My daughter actually gave me the name of one of her friend's father, and he was diagnosed with mesothelioma. He happened to live 5 minutes away from where we lived. So I got to know Neil, and we'd go visit him occasionally, and it became, Neil was he was an Italian hairdresser, and he made his wine, and I always got a bottle of wine from Neil, and we go there, and the cookies came out, and if anybody's Italian, you know what I'm talking about. And Laura and I were away on vacation, and we came home. We heard that Neil had passed away. So we went to see his wife, Rosa, and I never really understood what the long-term survivors mean to the community, that are the first-timers that are just being diagnosed. And we spent about an hour with Rosa, and Rosa was, I'm like 5'11", and Rosa, her head came up to about here, and she was walking us to the door, and I had my arm around her, and she looked up at me and she said, Neil always would tell his friends, I met this guy that survived. I couldn't get out of the door before I started crying. And that is what we're all talking about here, to stay together, and part of knowing that somebody can go 4 or 5 years. I told Locke last year, 10 years from now, he's going to be up here giving this presentation. And you will, I know it. And it's just about that staying positive and looking, Julie had asked a question at the end of the other session about an hour ago, and it triggered something in me, and I always wondered why I sat here and I said, I'm going to beat this, and I realized what it was, because I was about 16 years old. My mother had a huge tumor on her intestine. I lost my father to pancreatic cancer years later. My brother had 2 valves replaced in his heart, and he had all these surgeries, and I was so hardened, but I knew that there was hope there, because people a lot of times assume that this happens, you're not going to make it. And I saw my whole family make it. And I sat there and said, I'm going to make it too. And that's just the way I looked at it. And when I heard everybody this morning, I don't think there was a person in that group over there that said, I'm not going to make it. And that really lifted me up. I mean, I don't know about you, but that really lifted me up this morning. So we could talk about a lot of things. I could talk about survivor guilt, but I want to ask, does anybody have questions? You want to bring something up about survivorship? Did I do my job? Oh, okay. Well, I'm going to talk a little about, I'd like to talk about survivor guilt, because it really goes back to that story that I told you. And it's probably the toughest part about coming here, because I've met so many people, and I'm not going to lie to anybody here. We've lost a few people. And every year I come here and I say to myself, why? I always say to myself, why? But what gets me going is to see you look up here and say, oh my God, 19 years. Oh my God, 12 years. All right, so that's how I get around the survivor guilt. Please help me.
So I think that for me it is difficult to know how many people we have lost, but I know that every year survival rates do get better. I see the doctors that come here devoting their lives, their work towards helping people like us to make sure that we live not only longer but better lives. And it can be frustrating as a patient, right? Because we've all gone into the doctor's office. Some have had great experiences. Some have had not so good experiences. Some have been sugar-coated. Some have been straightforward things that we don't want to hear. And it's hard to navigate through that type of conversation. And a lot of it is coming to these symposiums, developing relationships with other people that help give you motivation and understanding on how to have a common language between you and your doctor that benefits the conversation. So either you understand it more, or your doctor understands what you're trying to do and where you want to go and how you want to live and how you want to be treated. And I know that for me, my perspective has changed over the years. And Heather, you were saying that a little bit earlier. And it is a constant evolution that you will go through the longer and longer you go through treatment. And even when you're out of treatment. For me, survivorship has started to mean different conversations with my primary care. And not only my primary care, now my rheumatologist. because now you'll understand that there's secondary diseases that you might develop or afflictions you may have that you need additional help. And you will learn the medical system and hospital systems.
Hello, pre-diabetes.
Right, more than you know. So I think that having those discussions that's relevant between patients here and in your networks will help you have the resources in your back pocket to be successful in your own navigation of your own treatment plan. And that's one of the reasons that I look forward to coming here. Now, in terms of survivor guilt, one of the things that I do to overcome mine is to celebrate the relationships and lives that we have lost. Talk about them frequently and let their loved ones or their bereaved know just how much their loved ones meant to me. So, you know, I know that we talked about Bonnie Anderson earlier. She was a ray of sunshine in her own unique way. And we'll all remember all the conversations we ever had with her and all the things that she has said to us that have benefited us along our own adventure. So, you know, don't get down on the changes or evolutions or perspectives that you have that change. Just try and recognize it and try to solution that will benefit your own treatment.
I mean, of all the guilt to have, I think survivor's guilt is probably one of the best. Maybe I'm weird, but the support that we get from the bereaved community, from somebody who's lost a loved one, from people who are 1-2 years out, my gosh, I can't tell you how much that means. And to have the support from somebody who's lost their loved one and to have them cheer us on and to tell us thank you for doing what you do, that keeps me going. And I'm going to talk about the foundation again. We sound like we're disciples, but we kind of are. Because this foundation has really given us all that foundation, word play on words there, to build our advocacy lives and to build our life in addition to what we are at home. And it's just such a unique way to get to know people. And somebody has to beat the statistics. Why can't it be you? And that's what I stick to. So that's how I deal with survivorship guilt. And like I said, of all the guilts, it's a pretty good one to have.
Any questions, or before we move on a little bit? So,
Solomon has one.
Oh, I'm sorry. Can we get? I can hardly hear you. Do we have a microphone or? Oh, we got. Okay, I'll get it. I'll get it.
I guess so. All I wanted to say is thank you so much, because I'm still relatively new to meso, previously lung cancer, now meso. But seeing survivors, the first time I had no idea, and I went on a meeting with Julie White on one of the Zoom meetings, and people lived, and that's not what I expected. So it's just great to see this. It gives me encouragement, and hopefully gives everybody encouragement. Thank you.
Thank you. Thank you for saying that.
Thank you, Solomon. I'm going to touch just briefly on that, because I remember back when I was first diagnosed, I was fortunate enough to have somebody who happened to know a survivor. And they said, and this was back in 2011 too. Sorry about that. It was back in 2011. Somebody said, you should really talk to this person. They've been surviving with it for 14 years. I said, for 14 years? I said, yeah, give him my number. Have him give me a call. And sure enough, the gentleman gave me a call. And he says, hey, Bill, I heard that you wanted to talk to me. Yes, I had mesothelioma for the last 14 years. And I said, well, naive me at the time. I said, when did you have your surgery? And he says, I haven't had any surgery. I said, you haven't had any surgery? I said, well, how long have you been cancer-free? And he says, I'm not cancer-free either. I said, oh my God, there's no escape. I said, well, tell me about yourself. And he says, well, I have full encasement of my right lung, and I have a brick-sized tumor in my gut. I have dual compartment. And I thought to myself, oh my God, what am I going to do? What am I going to do? I got to get rid of my cancer. And this guy's walking around with cancer 14 years later. I said, well, what have you done? I said, when did you do your treatments? How often do you do them? He says, well, at the time, this was 2011, he says, I haven't had a cancer treatment for 11 years. And I said, wait a minute, you're telling me that you haven't had a cancer treatment for 11 years? He says, nope. I said, well, what did you do? He said, well, I had a lot of chemo. He said, I had a stroke too. I went through some hardships during my treatment, but suddenly my cancer just kind of arrested itself, and I haven't had any problems since. He says, yeah, it's hard for me to go up and down stairs, and yeah, I've got problems here and there, but I'm alive today, and I get to see my kids and hang out with my family all the time.
Mm-hmm.
And luckily for me, this gentleman didn't live too far away from me, so we decided to have lunch. And in seeing him, it started my own wheels turning. It's like, well, you know, this might be doable, and I'm going to change my thinking to, yeah, I'm not going down without a fight. That's one. Two, I think I can do it. It sounds like a little Thomas the Engine. But you know what? There's some truth to that. You got to bolster your own mind to be able to push yourself up that obstacle. And for me, it was beneficial. And when I saw him and talked to him, I walked away with a different perspective. And even here at the symposium, everybody that I talk to has an influence on me and changes my perspective. You know, I've already met Nicole and David and Rosa, and I could name almost all of you that I met, but I won't take that time away from you. However, everybody that I talk to, I'm learning something new, and that something new is going to benefit not only me, but maybe I'll give you some information that might benefit you. So that's why I love the symposium. That's why the foundation's near and dear to me. We have networking opportunities that are unlike any other thing, especially in the cancer space.
Go on.
Ditto.
Ditto. So, are you?
No, I just yeah, it's learning from one another and realizing that all treatments can get you somewhere, and like surgery isn't the answer, immunotherapy isn't the only answer, chemotherapy isn't the only answer. There's a number of treatments out there available to get you where you need to be, so don't give up hope. That's what I think kept me going in the early days, is if I can just get to 5 years, treatments will have developed that I can keep going if I can just stay 1 or 2 steps ahead. And that's what I keep telling myself. And now in the last 19 years, I have seen so much advancement. It's mind-boggling to see what is available now. I joke and say I was diagnosed in the dark ages. They don't do this surgery anymore that they did to me. Very, very rare cases. So, yeah, just being a part of the community is really a privilege and an honor, and know you're plugged into the absolute best information, and a direct link to the doctors with Julie, and her information and her knowledge is second to none. So you guys are in a great spot, and I'm really glad you're here.
Yeah, and just to give everybody an update on that person that I was speaking of, I think he's 24 years out now. It's Michael Loudon.
Oh, okay.
Yeah.
Okay.
But
so, kind of pivoting a little bit to survivorship. The unsung heroes that are part of our survivorship are our caregivers, and I can personally say that I probably would not be here today if it wasn't for my wife Laura. Did I get it right? You wrote it down. I just wanted to make sure I got it right. Yes, she did. She did. She's gonna take it back. She's gonna go right into my wallet later. But so one of the sessions prior to this, they were talking about anxiety and all those things, and I can't tell you how many times I was fortunate enough to have enough sick time at work that I could just get treated and get whole before I went back to work. And in the early going, I used to lay down on the couch. Laura would go to work, she'd come back, and she'd find me in the same position. And I can't tell you how many times she's grabbed me by the ear and picked me up and said, let's go out for a walk, let's do something. Very instrumental in me keeping my mental attitude going. The other thing that I did was I came up with some goals, you know, and one of the goals was very near and dear to me. I wanted my grandchildren to remember me. So that was one of the things that drove me as well. You know, I always said, if I have to make sure that when my time comes, that my grandchildren will remember me from their early experiences, and doing pretty good so far. I have 6 of them. One's in the Marines. I have 2 14-year-olds, an 11, a 10, and the terrorist is the 6-year-old. And she'll remember me because we butt heads all the time. But yeah, you really are a team, and your survivability is it is teamwork, and making sure you get to all your sessions, making sure. I got reminded this week that it's time to go to the NIH for your annual checkup. So all those things all those little things come into play. So remember those things, and the foundation at some point in time is going to reach out to some of you and ask you to participate in certain things. What helped me a lot, and Heather was part of this as well. Did you ever go to the CDMRP? Yes. You did. You didn't too. So we touched a little bit this morning about the congressionally directed medical research program, the money from the government, and we got Maya. When do we get on the DoD list? 2008. 2008. By the way, if anybody has not met Maya has moved on and taken an opportunity someplace else. But Maya is one of our dear friends to the foundation. She's been part of the foundation for how many years? 18 years. And there's Rob back there. Rob was also a cast member for the for the foundation as well. The DoD gets a chunk of money every year, and mesothelioma is put in a pool, and they have the doctors come in and they review grant proposals. They're looking for research dollars, and the foundation they allow you to have what they call. No, not peer reviewers. We're consumers. Consumers. We're considered consumers, but we are a patient on the panel that gives our input. We actually get to review these very complicated grant proposals.
Google is your best friend.
Yes, Google is absolutely, and all these other things. And you actually vote on the merit of each one of those grant proposals. Did you go through that process? So, okay. So, I'm sorry, I don't remember your name. Amanda Woodward. Amanda's doing the chemo brain, dear. I can see it on your face. And I have to say that was the largest grant that was given that I've ever seen. It's usually $500,000, $600,000. They made $1.25 million. That had to be a great grant, a great proposal. Yes.
I reviewed that one. I was able to review that one in the CDMRP thing.
So as we progress, as all your new patients progress, and the foundation reaches out to you to do something like that, consider it, because it is so rewarding, and it keeps you up to date on everything that's coming down the pike. And the foundation does the same thing. We have 3 or 4 seed grants every year. They're considered small grants, but they're really proof of concept grants that some of them have gone on to get $750,000 from the DoD. Well, we have to stay on that path and keep us active. And if next year we go back to Washington, that's probably one of our asks, because meso comes up for review every year. They're always looking to get it out to get somebody else in. So we go to our senators and our congressional reps and we say, please, please, please keep us in there. But get involved. It keeps you whole, it keeps you healthy, it keeps you active, and it is so rewarding when you vote on something and it actually gets funded. So try to do those things if the foundation reaches out. The Community Advisory Board, again, always looking for new people. What else, Bill? What else do we need?
You know, the foundation does a really good job of communicating what grants we're funding every year. And from that seed money, I know that I've been personally impacted just with the WT1 peptide vaccine a long time ago. But things that you can stay engaged with are making sure that you attend the patient call if you're a patient, or engaging in our partnership. I don't know how to say it. Partnering with another meso patient, like patient buddies.
Peer-to-peer.
Yes.
Peer-to-peer. Yes,
Peer-to-peer
thank you. And that can be quite helpful as well.
That is rewarding when you actually get to speak to a newly diagnosed patient.
Yes.
And again, giving them hope. Go ahead. I'm sorry for interrupting.
No, you're good. The patient call, the monthly patient call, that's one. The monthly caregiver call, that's two. The CAB socials, that's three. We have a lot of things on the calendar that are going. Make sure that you stay active and engaged. You can meet other cancer patients who have gone through the same or similar treatment like you. Stay also engaged with Julie. Julie can help connect you with resources that you may need, whether it be medical professionals, or if you want to ask another patient who has received maybe a treatment that you're thinking about doing. That way you can get some anecdotal findings from them.
No matter where you are in the process, we're there to meet you where you're at.
Yep.
And we will be here ready and waiting for you when you're ready to jump in.
And I just want to point something else out. I have a note about staying involved and not pulling away. It's very easy for the three of us and Jessica and 10 years from now you to go home and just say, we're over with this. We have to move on. It's so rewarding to know these people and to know that they're still here advocating for everybody and helping everybody, and try not to walk away. It's hard not to do that. I understand. We all understand that. But it is also so rewarding to stay involved and get to help other people as they're coming through. So, do you have anything else you want to talk about?
What I was thinking, anybody else have questions?
Yeah, that was the next question.
We've talked a lot about different experiences and evolution of cancer treatment over time and perspective too. I got to think that,
there we go. Bob.
You may or may not be able to answer this.
Oh, if we can't, Maya will be able to answer it. Don't worry.
Obviously, at the beginning, for me, the support groups are incredible, and Bill, the hope that you guys provide is amazing. I'm just curious, you've talked about grants. Like, what is the total budget for the foundation, and how much is actually dedicated to grant and research? Is that something you guys are prepared to talk about?
I've gone through the process, and tell me if I'm misstating something or anything. So, I think we got 20 grant proposals last year, or 20 or 30.
And I am not the financial person, so don't hold me accountable for all of this. Last year, I think we had about 20 to 30. And then we fund, there's not a set amount on how many get funded. It's really about how many come in. Our science advisory board and then the medical members of our board are the ones who make that final decision. They have an advisory period where Julie meets with them. They look over all of the things that are meso related that come out, and then they make choices on how many grants we're going to fund. So some years it may be 2 grants, some years it may be 3. It's really dependent upon what grants are there and are available.
Yeah, they're basically, everybody votes on them. They're given a rating, and then the board decides where the line is cut. So it could be, like Melissa said, could be 2 grants, could be 1 grant, could be 5 grants. All depends on the validity of what. Some of them come through and you could see they're just throwing it up against the wall, and let's see if it sticks. But the Science Advisory Board, they're probably the top meso people in the country, and they know, and they've seen these grants, and they know what's valid and what's not valid, and everybody gets to vote on them. So it's not a set number every year. And how the grants go out, it's a 2-year grant, $50,000 each year, and it doesn't stop the person that's asking for the money to get money from other areas too. So this is just maybe supplementing what they're doing. But it's $50,000 a year for 2 years. And they have to report back. Where did Melissa go? We lost it. They have to give reports back to say by the second year. Okay. So it's a comprehensive process, and and if anybody wants to do that and they still have the patients participate, reach out to the foundation and say you're interested in doing it. It's a very rewarding experience.
And our grant applications are opening on November 1st, too, so it's coming right up.
For the letters of intent, correct? Okay, and that's for research funding. However, we do have some other grants that are available to our community at large, and that is travel grants for treatment. So we have several different funding channels that can help our community move forward.
So,
are you using any supplements, alternative therapies, diet, or anything that you believe in? Did you hear me? Or have you used any along your survivorship as well?
I eat a lot of pie. And it makes me very happy.
Well, good. It makes me happy
and
too.
And therefore, I have lived a long life.
Yeah, okay. Okay,
And,
good. As long as you make me happy.
I get that a lot. It's like, oh, what supplements did you use? What diet did you do? There's no diet that's proven to ward mesothelioma off, make you healthier, or whatever. I say everything in moderation.
Mm-hmm.
I like pie. I will not eat an entire pie, but I will have a piece now and again.
You dropped down from half?
What?
You dropped down from half?
I did. Now I just got my stomach shrunk. Anyways, everything in moderation. I don't do supplements because, frankly, they make me barf. They upset my stomach and I don't feel good.
Mm-hmm.
Other people swear by a vegan diet. Other people swear by a Mediterranean diet. It's whatever works for you, gives you quality of life, and makes you happy.
Right.
That's what I subscribe to.
Yeah, exactly. And you haven't tried any, like, I don't know what people write, like IV vitamin C, that type of thing?
No.
So
Huh?
I want to piggyback off of what Heather said. I remember one of our first conversations, and I won't forget it. I spoke specifically to Heather about diet. And I said, a lot of girls at the local cancer community, they say, I'm swearing off sugar and already I feel better. I'm swearing off this or that and they're feeling better. And Heather says to me, she says, you know what? Does that cheeseburger make you feel better? And I said, I'll be darned, yes it does.
Yeah.
Don't sacrifice your happiness. And, I'll have a cheeseburger every once in a while. There is the moderation piece, and I have changed my tune over time, but don't sacrifice your happiness over, a nice, just one scoop of ice cream. I don't know, but I have changed a little bit of my diet to be less red meats. I've already noticed a difference, and I've kind of gone away from a lot of breads, but I supplement with like rooted vegetables like potatoes, sweet potatoes.
Different form of carb, that's all.
And the weird thing is, like, asparagus, I kind of love it now. And I feel like I know it's working. You know how I can tell?
The scale.
Well, that too. But I do feel better. I have more energy.
Yeah.
As far as supplements, I used to take supplements. In fact, I used to talk to a naturopath over at Sloan Kettering, and her and I spoke about a lot of things, and a lot of it worked for me, what she said, but I have since weaned myself off. It's tough to do on a daily basis and continue that for the rest of your life. It's really all about talking to the right people. Talk to a nutritionist. They can kind of help you through other things. I noticed that I don't have as much inflammation in my joints just because I'm also a person who is on immunotherapy and experiences a little bit of arthritis over time. Well, if I eat certain things, I flare up a little bit, and I'm like, oh man, that bread, I shouldn't have had that big of a piece of bread, but I'll go ahead and I'll have a small piece of bread. And yeah, I know I'm going to pay for it, but you know what? Not as bad as if I ate the whole loaf.
Yeah.
So, you know, you got to think of what the future is going to be.
I you know, I'm a caregiver. My son is 39, you know, with peritoneum, you know, for a year and a half. And when he first was diagnosed, you know, of course, I jump in and read all this stuff about everything. And there's a lot of articles out there about, you got to drink this vegetable juice, and you got to do this and that, you know. And I got caught up with that a little bit in the beginning. But it wasn't his choice. It was like my choice. And now I realize, you know, it's his choice. And he, you know, you have to, attitude is probably more important than any of that stuff, you know. So I've kind of, so I'm happy to see that you're not like totally living because of your.
Just a word of caution about supplements. If you're being treated, talk to your oncologist, because, you know, it's that grapefruit thing. Don't take your medications with grapefruit because it's plugging some receptors that.
Right.
That, you know. So
yeah.
just
Well,
be
right
careful.
now he's on chemo, and he can't. The doctor said, no, you know, you can't.
I'm here in spite of my diet. So
Yeah,
I'm
that's right.
here
I'm
in
happy to
spite of
hear
my
that.
diet.
Yes, that's great. Great. I'm all for it.
Like
Good.
my doctor did tell me I was mildly pre-diabetic, so I do have to lay off the pie.
I know.
So I'm not happy about it, but I'll do it.
Yeah. Okay. Good. Thank you.
So anything else? Any other questions? We answered them all. Great.
We are all available all weekend.
Oh, there we go. Oh, she's got it. By the way, John, we invoked Bonnie before. Just want to let you know. When you look at the videotape, we invoked Bonnie.
I feel like it took me a long time to want to participate. In the beginning, I didn't want to participate, and then I started occasionally doing a Zoom support group, and then I got a little bit discouraged with that and kind of pulled away, like you said. And I feel like I don't know how to go about learning, you know, how to become an advocate or something. Like I feel like I don't have that information of who to talk to or who
I got you.
Okay. I just feel like it feels overwhelming to me. Like the support groups a lot of times feel overwhelming to me. Like I feel like I need something different. Like I want to participate in things that don't make me feel overwhelmed.
Talk to me. I'll set you up.
Okay.
Anybody else?
I know you're still survivors, but at what point, you know, 3, 4, 5 years, did you start to think, like, maybe I have this?
I got it.
Yeah.
I'm still not there.
Yeah, you know, we talked about scanxiety, and I still go for my scans once a year. And, you know, I'm a big advocate of listen to your body, because I didn't listen to it in the first, you know, before I got. And every time if I stub my toe, I'm worried. You know, if I feel a little twinge on my side, I'm worried. So it doesn't go away. It's like losing somebody. They never go away, but they're further back in your mind, but they're always there. And that's how I see it. It never, you know, considering the type of disease it is, I always have my guard up. So it's just me, but, you know, I mean, I'm 18 years out, and, you know, I beat the statistics, if you want to talk about statistics again, but it could happen, you know.
Yeah, I think it's something that's always looming for me. And I think it's looming for a lot of patients, no matter how far away you are from that diagnosis date. And I come here because this gives me the best chance, best opportunity, best shot at having all the resources I need for the best outcome I can get. And I know that these doctors have our backs. They make sure that they steer us in the right direction to have the most successful outcome or treatment. So, yeah, I appreciate that question, because a lot of people may look at us and think, oh, they got it in the bag. No, I don't think that anybody has that feeling, but thank you.
That's a great question.
Anybody else?
Tanya, nothing? No, no, no.
Hey, Rich, and
Uh-oh.
I don't need a speaker.
Uh-oh.
But one lady that was talking about how to start, you mentioned something to me that you didn't want to mention because of what Laura had said. You supposedly started stuffing envelopes for the organization. You want a little job? I'm sure we can find something we get involved and grow from there.
I just have to say, John, I remember her doing that. She doesn't.
I know.
So
Sorry, Laura.
I think it was at the Omni Showroom, and we were helping out at the desk coming in. So, but that it starts there, just little things, And if the foundation reaches out to you and asks you, would you like to talk to a newly diagnosed patient? It is the most rewarding thing you can ever do. So anytime they reach out to you to do something, think about it. It's not for everybody, but think about it. Okay, thanks. Good job.
Thank you, Rich, Heather, and Bill for that. So we've had a great community day, and I have a few people to thank for that. We as a staff are small, and I hope that you've seen us as mighty, but we do not do this on our own at all. So I want to thank our speakers, our support group moderators, and all of our panel members that are here today. This symposium is not always easy to put on, and whenever we have come up with ideas and then reach out to Heather or Rich or Jessica and say, hey, you all want to come do this? They're always like, yeah, sure. And majority of those people all of those people either currently serve on the Community Advisory Board, the board, or previously have. And so it makes it really easy when you have a lot of great people that you can be like, hey, Locke, you want to do this? And he says yes, whether that's just because he feels guilty or wants to. But it makes it a lot easier to do that. I also want to thank our sponsors, Bellick and Fox, the Law Office of Dean, Omar, Branham, and Shirley, MRHFM, Merck, the Gorey Law Firm, Bristol Myers Squibb, and the Early Law Firm. And then I want to give a personal thank you to the Community Advisory Board. I know that Brian talked about them earlier. I get the honor of personally working with them as like the staff liaison with them. And so this all started back in March, April, when I come to them and say, give me your big ideas and let's see if we can make them happen. And so this symposium was really exciting, getting to sit down with them and say, what do you all want us to do? Please give us your ideas, and kind of like seeing those things come to fruition. I won't ask you all to stand up again. But if you are interested in getting involved, I know Rich just talked a lot about that. Please look for one of them. They have orange ribbons on. So go talk to one of them, talk about getting involved, come talk to a staff member, and we'll probably send you to one of them to talk to. But it really is a great way to make your voice heard, to plug in with the foundation, to stay updated. And then it's a great way just to get to meet some really amazing people. We're now going to go into our welcome reception. We have one thing really quickly before that. We're going to take a large patient group photo if you are interested in participating. This is something that we've done for years in the past, and we have great photos looking back on all the patients that participated. So Rob, our photographer, is going to be out in the lounge. There's a big patterned wall out there. So if all of the patients that would like to participate in a couple of minutes want to go out there, he's going to get you all arranged, and we're going to have a really good photo. And it's going to take us right into the next thing, which is our welcome reception. We're going to have a bite to eat for you to grab, grab a drink, take some time to socialize, and really get that community time in. Tomorrow we're diving right into science. And so we'll be back here for breakfast at 7:30 to 8:15 tomorrow, and then we're going to start Science Day at 8:15 in the morning. But let's go on into the reception and have a photo. Huh? Yeah, if you want to, we can go ahead and do that right now. Okay. If the cab members want to stand, we can do that. They're not all in the room. I know some of them went out. Yeah, we can do a cab picture as well. That's perfectly fine. Yeah, let's do that. Okay.
We're here for you.
Thank you all. We'll head out into the reception and get that picture done.
Hi, my name's Joe Bellick, and I'm the founding partner of the law offices of Bellick & Fox. We support the mesothelioma community by providing first-quality legal representation to mesothelioma patients and their families. We're proud to support the Mesothelioma Applied Research Foundation so they can continue the work that they do every day on behalf of mesothelioma patients and their families.
Hi, I'm Trey Branham. Dean Omar Branham and Shirley is proud to sponsor this year's Mesothelioma Applied Research Foundation Conference. The 34 lawyers at Dobbs have more than 400 collective years providing legal representation to victims of this insidious cancer. We applaud the leadership of MARF and this community for its tireless dedication to finding a cure for this totally preventable disease.
At MRHFM, we exclusively help mesothelioma patients and their families. It's all we do.
This is why we are proud to sponsor the Mesothelioma Applied Research Foundation and its work to fund mesothelioma research and provide support services and education for patients and their families.